Hall, sponsored by the Wisconsin Legislative Black Caucus. I'm State Representative Lakeisha Myers, and I humbly serve as the interim chair of the Legislative Black Caucus, and I will serve as moderator of today's event.
Cannot hear you.
You can't hear me,
I'm so sorry. I cannot hear you.
Okay, let's see. We hear you. So, Congresswoman, we can hear you.
Dr. Izzard is asking if we can see him in the chat.
No, we cannot see him yet.
Yeah, no.
Is his computer on? Is his, let's see.
I cannot hear it. I'm gonna have to go back.
If someone can shoot off a message to the Congresswoman, maybe she has to click on the audio.
Her audio is on because she's not muted, so I can see her. Is her audio on her computer?
Exactly.
Okay. Congresswoman, you might have to call in on the phone. We can see you, but we can't. Speak once, Congresswoman, to see if we can see you or we can hear you. Okay, she's checking something. Let's see.
I was hearing her a second ago.
Okay.
She may have accidentally signed in without the audio.
She might have. Okay. I see she is off now, so she might. Okay.
My phone?
Keyboard on mute.
So my keyboard? How do you get the keyboard off of mute?
Okay. So we're going to mute everybody that's on the panel right now so we can do our introduction.
The keyboard is on mute? Where's the keyboard? Oh, here it is. Can you hear me?
Yes.
Oh, yes, my God. Thank you. I got this laptop yesterday, and my nephew was playing with it.
You got a new laptop.
But I didn't. Okay. All right. So I am so sorry to be so disruptive. So I missed a lot.
All right. I think we are ready. Do we have Dr. Izzard? Hopefully one of our hosts can help Dr. Izzard.
There's some messages.
How do I get on?
You see the chat?
Yeah, I can see him. Okay. Hopefully Kenya and Katrina are helping him do that. Okay, so let's see if we can.
I was fussing at my son. He said, "Mom, I'm trying to help you. You need to unmute the computer."
Okay. All right, so greetings everyone and welcome to our COVID-19 Tele-Town Hall sponsored by the Wisconsin Legislative Black Caucus. I'm State Representative Lakeisha Myers and I humbly serve as the interim chair of the Wisconsin Legislative Black Caucus. And I will serve as the moderator of today's event. At this time, I would like to recognize all the members of the Wisconsin Legislative Black Caucus. They are Senator Lena Taylor from Milwaukee's 4th Senate District, Senator LaTanya Johnson from Milwaukee's 6th Senate District, Representative Jason Fields from representing Milwaukee and Glendale in the 11th Assembly District, Representative David Bowen representing Milwaukee and Shorewood in the 10th Assembly District, Representative David Crowley representing Milwaukee in the 17th Assembly District, and Representative Kaylin Haywood from Milwaukee, the 16th Assembly District, and Representative Sheila Stubbs of Madison representing the 77th Assembly District. Before we begin, I would like to thank you all for logging in today and taking part in this unique and enriching experience with us today. I would like to let you know that this is an interactive experience that we're having today, and we will be taking your questions. So if you have questions while we have panelists that are speaking, please utilize the chat function and we will get those questions. Also, if you have or need immediate assistance, we do have staff that are working on the phones. You can contact one of the staff members to get you immediate assistance at 608-266-5813 or area code 414-342-7176. And I'll repeat those numbers for 608-266-5810 and 414-342-7176. So a lot of Senator Taylor's staff are standing by to take calls if you have issues with any of the agencies or any of the items and need additional assistance today. We have people in real time that will be able to help you and assist you. Once again, those numbers are 608-266-5810 and 414-342-7176. All right, as we begin, I will defer because I don't see Dr. Izzard here right now. I think he's having trouble getting in, so we will go to our second panelist, which is none other than Representative David Bowen. I wanted to have David Bowen tell us about his experience with COVID-19 as one of the younger individuals on the totem pole. We hear a lot about COVID-19, and we've heard some of the harrowing experiences that individuals have with regard to COVID. And Representative Bowen, you actually had an experience with COVID. You're a survivor of the coronavirus. And we wanted to hear from you today to just talk to the general public about what your experience was with the virus. If you could go ahead and share that with us at this time.
Absolutely. Thank you so much, Representative Myers. I want to make sure, I think the mistake must have been made. I see Supervisor Supremo Omakunde in the chat, and he's trying to get cleared as a panelist so he can have his video on. So I think the staff might have to work that out. But shouts out to you, Supervisor. He's somewhere out there, so we got to find him. Is that him in the background that I hear? Okay. So we'll figure that out, but I want to make sure I acknowledge the only way I was able to make it was only through the grace of God. And I'm thankful that so many people reached out. I got a ton of messages and people that were just praying and sending good hopes and love and light on my behalf. So I'm really appreciative of that. This pandemic started being called a hoax. It started from the standpoint of underpreparing our communities and folks in our country of the real impact that it will make on our communities as a whole, but also on us as individuals and our health. So I think back to realizing after get on the phone with my doctor after seeing him and hanging up the phone and thinking about what was I told about this virus? Of course, the President of the United States called it a hoax. Of course, you had friends in your ear that said, oh, it's only just the flu. And then I definitely saw the social media posts that were about, Black folks can't get the virus. It came from a cell phone tower. All types of nonsense was talked about this virus. And it really reminds me of the massive amount of misinformation that was spread in the 2016 election. So it's really important for us to recognize the context and how we came into dealing with the virus that we are dealing with today. I came in contact with a local elected official in Shorewood, thought nothing of it, saw him in the cafe. We sat down, we talked, we caught up. And within 48 hours, I started really feeling like these cold symptoms. You're talking about coughing and body aches and body chills, but usually those things just go away after a couple of days. Not only did it not go away, but the symptoms ramped up. And by a number of days later, it was just really in the back of my mind that I wonder if this is the actual virus that started on the other side of the world but I really doubt that. This has to be a code. This has to be something regular. And I got an official call from the North Shore Health Department just saying, hey, we think that you have been exposed to COVID-19. To be on the safe side, monitor your symptoms. And by that point, everything started to really ramp up. You're talking about a fever at 104 degrees. You're talking about the shortness of breath that happens in your lungs. And, thankfully, I had a primary healthcare physician. For folks that don't know, before I was elected, I worked as a community organizer. I wasn't used to having healthcare, let alone having a primary healthcare physician. So I'm thankful that I have that now, but so many people in our community and the Black community don't have that. We are reliant on emergency rooms and urgent care. And, for the few great opportunities that we have, our community health centers are really building a lot of support and needed healthcare access. But when you look at folks as a whole, it shows the disparity. So went to my doctor. One of the few tests that he had access to at the time, this is very early in the impact of the pandemic. You have a nationwide shortage of tests not being available. I finally get access to a test, and 3 days later, it is positive that I have COVID-19, and I'm on mandatory quarantine to fight through it. By the time I'm paying attention to the numbers, within 7 days of my symptoms continuing and the impact on our community, you see that the north side of the city of Milwaukee, you see that Black and Hmong families are where Black and Hmong families live on the map on the county's website continue to grow blue and blue more each day. The numbers triple from the day I was on mandatory quarantine within 7 days. It really highlights the amount of disparities that have long been in our healthcare system, have long been in our country, and have gone unaddressed, and allowed this virus to really show that it has exploited our livelihoods and our ability to be well and to deal with this. So, was able to make it through this without being hospitalized, without extensive care, just building on my immune system. But I am a 33-year-old millennial. Before this, I didn't even own a thermometer, believe that or not. I'm healthy, right? But this virus sat me on my hind tail. So I couldn't do anything. I barely could stay awake during the day because your body is fighting this virus. My body's actually hot, but I feel cold, so I'm wearing a winter hat in my home, trying to stay warm. The shortness of breath I'm so glad I don't have asthma, so shouts out to all the other folks in our community that have asthma. If you do not want to have to deal with this virus. But it does exploit your pre-existing conditions. So it was important from the standpoint that I did everything that I could to just build up my immune system, sustain my health as much as possible during dealing with the virus. And I wrote a column for The Guardian website, and I will put that link in the chat so folks can check that out for much more detail. But I'm thankful that I made it through, and thankful for so many people believing in God that I'll be able to be spared, including my congresswoman. She was so close around the corner, and I couldn't even get close to her because I was like, no, you can't.
Well, you probably have that antibody now, so you can bring me the bottle of red wine.
Yeah, right.
One of my few visitors I'll receive.
There you go. Thank you, Representative.
Absolutely. Thank you so much, Representative Bowen, with telling us about your experience, because I think that was good for the public to hear, especially to hear from someone that is your age. Like you said, you're a millennial. And people, let me just say, millennials are almost 40 years old. So we are not the Gen Z people that are on the beach that you all are looking at. That's not us.
Well, the funny thing is, if you remember that interview with the Spring Breakers I forgot where they were, in Cancun, or they were in West Palm Beach. I forgot where they were. But they were like, well, if I get the virus, I get the virus. And a group of students from the University of Texas came back with at least a third of their group of 70 students with the virus. And
wow.
I mean, when you go through it, you find out that it's much more intense than just a regular flu. So that's a third of their group that now has the official experience of dealing with this virus.
Absolutely, because we are not invincible. So I'm glad you put that out there, that even though you may be young, you are not invincible.
Yes, and young people
Right.
young people have the virus.
They want thank you.
I want to have Congresswoman Moore. I know you have another engagement, and I see we have Dr. Izzard with us. So
Hello,
we're going to go in that order. Hello, Dr. Izzard.
Oh, you can take Dr. Izzard. I mean, he may fade out like I did earlier.
You go first. If you tell me where to go, yeah.
Well, we have been talking about the health impacts of the coronavirus package, and I was going to talk more about the grants and so on that were being made, the problems with the PPP. So we can decide. You were supposed to go first, so we can decide. And we just had David Bowen on, giving us his personal experience with it. Sounds horrible. Wouldn't want to be you. Except that the 33-year-old part seemed like it saved your life along with the Lord. This pandemic, should I go on, Senator?
Yes, ma'am.
Okay.
Yes, ma'am.
I think
And I touch and agree on that Senator part.
Oh, yeah, well, that's it. I know who that is. That is my dear Senator Lena Taylor. That's my personal senator. Let me say that in addition to wreaking the obvious health hazards, this has also created an economic pandemic on the country as well. So the Coronavirus Aid, Relief, and Economic Security Act, so-called the CARES Act, really focused on providing over $1 trillion to really address this pandemic. The things that people know most about is the Paycheck Protection Program, which started out being $350 billion program. You all also know about the Economic Impact Payments, the EIP, that was the $1,200 that is supposed to go out to everyone. And of course, the reimbursements to hospital and healthcare providers, the $100 billion to providers, and the CDC state and local public health had $1.5 billion go to them. All kinds of emergency response systems were supported. The SNAP program, or so-called food stamp program, there were increases in that fund, but they did not expand eligibility, which was a source of disappointment to us. I guess the reason that I talk about the package and pull out these couple of things is because these are the things that that I'm getting most of the phone calls on. The Paycheck Protection Program, as you know, it started out with $350 billion, and the money was gone in 48 hours. And it went to large publicly held corporations, and you've heard these names already, Ruth Chris and the NBA, and of course, you could argue that Shake Shack, their employees are poor. Their employees are marginal. They're still offering a curbside service and so on, so they deserve to be supported. But the point of it is that from the Democrats' perspective, this is not who the intended recipients were. But of course, this bill, as a defense to us, this bill was drafted in the Senate. And it was drafted, and this was their intent. And what we did in the House literally was to try to mold it and shape it for what it was. And it really did not trickle down. The second package that was just passed the other day added more money to the PPP. I was of the notion at one point that this program was unfixable because of the structure of the program. It's a program designed to help poor employees that have, 500 employees or less. So let that compete with all of the restaurants we know about. And so but what they were able to do is to do a small carve out of $60 billion for credit unions, community banks, and for CDFIs. Now, there are 32 CDFIs in the United States that are African American run, and 3 of them are in Milwaukee. One of them is Legacy Redevelopment Corporation on, 18th and North Avenue. They have it's a one-person shop. And they have like about $500,000 to lend. So, it may be possible for us to get some of our small businesses ramped up. If people who need $25,000 or less in order to.
So I just want to reiterate that, Congresswoman. You said Legacy Development Corporation.
Redevelopment Corp.
Legacy Redevelopment Corporation.
That's right. And they have one. There's a one-person shop, but that's what we have. I also wanted to talk a little bit about the EIP and to dispel some notions people have about it. First of all, it started out. I'm on the Ways and Means Committee, and it started out that they were only going to send the $1,200 automatically to people who were on Social Security, old age survivors, Social Security, and weren't going to send it to people on SSI or on other programs. And so we really said that doesn't make any sense, that you have a lot of these people's information on file, so be sure to send those Social Security checks out. But you do not have to be a taxpayer. So anyone who filed a 2018 or 2019 tax return should automatically, and especially if they have done it electronically and put their automatic bank information in, they ought to automatically get the $1,200. If you mailed off your return and you didn't give the IRS your bank information, then you may have to wait for it to come in the mail, because the place that prints the checks is different from the IRS, and they have a maximum number of checks that they write per day. And I forgot what that number is, but it has an impact on people to the extent that they may not get them for quite a while. The other thing is that I looked and scoured all through this legislation, and there does not seem to be any kind of prohibition against people who are out of prison to get this $1,200. Even if they're on paper, I don't see anything that would prevent them from doing it. The biggest thing that prevents people from getting this money is that the IRS doesn't know about you because you are not in the system. You've not filed taxes. You're not on Social Security. So you should go to irs.gov and follow the prompts there. And then you will have to give up information. It's a secure site, your Social Security, and so on and so forth. But I would urge people to get their $1,200. Now, that being said, it's certainly not enough money. And I am on all kinds of legislation, working very hard to extend. I see someone sent a message. Residents are still having trouble accessing the line. Yes, that's true. The lines have crashed because of so many people trying to reach it. But, rock steady until you get your money. We have provided state and local funds through the CDC state and local health departments. But the last fight now is that we have not provided monies for state and local governments. So when I think of the county board having to deal with human services, when I think of the state legislature, when I think of the city of Milwaukee expenditures that they have, our local school districts are suffering. We we really, and this is all political because Republicans do not want to strengthen our quote unquote base of teachers and public health workers. Now, I could see Dr. Izzard looking at me because we did try to take care of these community health centers. There was just no deal unless we took care of community health centers. But I'll tell you, I have been on the phone, and you know this is true, looking for PPE for our community health centers. I mean, whoever thought that as a congresswoman, I was going to have to be on the phone with doctors, running my traps on my contacts and people that I know to come up with masks and gowns. But that's what I've been doing as well. I think that I'm going to yield now because it's kind of boring to hear one person doing all the talking. And I'll come back in for the Q&A.
Okay. We needed to hear what you had to say, Congresswoman. And I think you know, that message was needed because we didn't know about the Legacy Redevelopment Corporation and those funds that are available, which could help some of our small businesses in our community to have the opportunity to make sure that they are still in business once this is all over. So
we can try. Right.
So we've done some local things. I know people are saying shop local, buy local from restaurants, especially restaurants owned by people of color, to patronize when they're doing curbside service. But this is something that I think with our African American Chamber of Commerce, as well as the Black Chamber, would be, especially privy to and want to extend to their membership and make sure that those businesses take part in that, whatever those funds might be. So I thank you for that. At this time, we will go to Dr. Kevin Izzard, who is the president of the Cream City Medical Society. Dr. Izzard, are you still with us?
I am with you. Yeah, I apologize for the technical problems starting off. And all of us have heard about coronavirus now ad nauseum. So I'm gonna try to make this interesting. I'm gonna try to focus on some things that I think that the politicians will find useful in trying to decide how we're going to open back up. Because the conversation has now changed from what is coronavirus and how do we protect ourselves to now how do we get on with our lives. What we know about coronavirus is that it's a novel virus, meaning it's new. It's the first time we've been exposed to it as human beings. And because of that, none of us has immunity to it. Now, normally when we come across a virus or any other infection, your immune system recognizes it. You make antibodies against it, you get over it, and you do fine. Well, in this case, this is a new virus. We think it might have come from bats. Somewhere in Wuhan, China, it got started. So there's questions about now whether this thing started in the laboratory, someone experimenting in China, or whether it came naturally from bats through another host. But needless to say, we have, since January, we now have this coronavirus. Now, when we talk about coronavirus, you hear people talk about coronavirus, talk about COVID-19. They're both the same thing. Actually, COVID-19 is the illness that's caused by the virus. Okay, the virus name actually technically is SARS-CoV-2. Okay, and some of you might recognize the SARS part because we had an outbreak, an epidemic of SARS back in 2003. And this virus is related to that virus. It's in the corona family, meaning that if you look at it in the electron microscope, it looks like a crown. So that's where the name corona comes from. But anyway, so the virus being new, and because we don't have exposure to it, there was a lot of fear when we first saw it, was that this thing's going to spread like wildfire because no one's immune to it. And unfortunately, some people ignored the initial warnings that this thing was coming, and we started off with a few cases. And the funny thing about this was that look back, even a month ago, we were talking about 20 cases, 30 cases, 100 cases, and with these novel viruses like this, because we don't have any exposure to it, they multiply quickly. And so you double the number of cases in a short period of time. So initially we were seeing doubling every 3 or 4 days. And so you had 1, went to 2, it went to 4, went to 8, went to 16, and it was doubling like that every 2 or 3 days. Now we've gotten, we've passed 1 million cases, and so this thing is taken off. The concern again is that because people don't have immunity to it, people's immune systems tend to overreact to it. And so the people that are most prone to it are people that are very old and people that have, why should they very old? But people that are old and people.
I was about to say, don't get on us now.
Okay. Yeah, I know, because I'm in that group too. People over 60 and people that have chronic medical problems like asthma, chronic obstructive pulmonary disease, COPD, people that have diabetes. Now, and we're not quite sure why that is. We think it has something to do with the fact that there's something about this virus that causes the immune system to overreact and is causing some what we call microvascular clots. So causing blood clots in small organs. And so a lot of people, the people that end up dying, they end up developing organ failure. So it's not just their lungs, not just pneumonia, but the kidneys shut down, the liver fails, and other things happen. And that's why they end up dying. So what we know, again,
about the virus. Those links, Dr. Izzard, to, how we know that African Americans are overwhelmingly represented in the population.
Right. And so that was an interesting that came up. And Milwaukee was actually one of the leaders in that because we reported our cases by race. And so a lot of other states and cities don't report their deaths by race. And so they had no idea that African Americans were dying disproportionately. Well, some of the theory is why that is one, we tend to have those illnesses more than the general population. So we're more likely to have high blood pressure, diabetes, asthma, heart disease, those kind of things. Also, some of it was, if you look around the area, a lot of it was density of population. So if you see these things popping up in major cities, you don't see it so much in rural areas. That's because people are more concentrated, and so you're more likely to spread a virus to someone near you than if you're distanced. And then the other thing is we're more likely to work those jobs where we're essential workers. So. And now essential doesn't mean the same as important. So we're more likely to be working at Walmart or the grocery store or working at the hospital, cleaning up the rooms. And because of that, we're more likely to come and be exposed to those things. We can't work from home a lot of times. So, that's another reason why, one of the theories why we're more prone to getting this. But for whatever the reason, we don't think it's because African Americans are more susceptible. We're not more prone. There's nothing inherently about us that makes us more susceptible to getting the virus. It's just that we're more likely to have complications from it because of our other, what we call comorbid diseases that we have. And so, so where we are now is in Wisconsin, about 60% of the cases have been African Americans of people who have died have been African American, and so we're disproportionately represent the number of COVID deaths in Milwaukee. We were seeing a lot of hotspots in the inner city of Milwaukee, and that's kind of calmed down a little bit. So it's not as bad as it had been a couple of weeks ago. We did see a recent spike just this week, it appears, and there's some thought that it might be related to the election. The people came out and they were in lines. And in fact, I went out to vote over here at Washington High School, and the line was around the school. They did their best to try to keep people safe, but even the election workers, some of them got the virus. So what we know, the best idea that we have now, or the best way we have to keep safe, is to, one, and you've all been hearing this social distancing. We want people to keep away from other people as much as you can. If you can work from home, work from home. If you can stay at home, stay at home. Try to keep 6 feet distance from other people when you go out. Wear a mask when you go out, and make sure you wash your hands frequently. And that's a big one there too. And that's something we should be doing anyway. So those are the major things. Now, the other thing that I think is getting lost in all of this is that we kind of get this idea that we're trying to stop the virus. We're not going to stop the virus. There's only 2 ways to stop the virus. One, we're either going to get a vaccine, okay, and that's still going to be several months away, or we're going to get what's called herd immunity. Herd immunity is when you get about 60% of the population that have already had the virus, and have been having immunity to it. So when that virus tries to spread, it can't spread to anybody because the people that are around you have already had it. They're immune. So that's what they call herd immunity. But that happens when you get about 60% of the people already having had the virus and gotten over it. Good thing is that the majority of people who will get this, because we're all going to have to get it at some point, either get vaccinated against it or we're going to get it. The good news is that the 80% of people, maybe even more, will have a mild case. In fact, some people, as we can tell already, have had the virus and didn't even know it. So we might have some people that are completely asymptomatic. Other people have mild cases. They might have a bad cold. It's about 15% of people that are bad enough where they end up in the hospital. And of those 15%, about 5% will end up on a ventilator. And the ones up on a ventilator in the ICU, they don't do well. So, and actually we're doing a lot better now as we learn more about the virus, about what happened in New York and other cities. We're doing a lot better job than what happened in Italy with their experience with ventilators. And so we've gotten better at treating it. There's a new medication, remdesivir, which they're talking a lot about, that blocks the virus from replicating. And so that's a treatment that we might be seeing a lot more of. We're still months away from a vaccine. With the vaccine, you have to, you got to make sure it's safe. So they first do these trials with animals. Then they got to go to human trials. So first they got to make sure it's safe. Then they have to make sure that you're making antibodies with the vaccine. And lastly, that confers some immunity. And what we know about other coronaviruses is that they usually don't give you long-term immunity. It's like one of the top 3 viruses every year that causes the common cold is the coronavirus. And coronaviruses, like colds, you get them every year. So you don't become immune to it, for long term once you get it. We don't know what's going to happen with this with the SARS-CoV-19. We don't know if this is going to be something that you get immune and you're immune for life, or if you get it, you become immune just for a year, or if we're giving people, there's questions about whether people can even get reinfected. So there's a whole lot still we have to find out about what's going to happen with this virus. So I think one important thing is that the people that are in the planning and how to open up the economy need to know is that we're flattening the curve. We're not getting rid of the virus. Okay, that means that we have to have some cases. So the idea is that people have to get it, but we don't want a big spike. We don't want to have so many cases that the hospitals can't handle it. That's what the idea of flattening the curve was. And so, in fact, I don't know if you can throw that picture up here, but you guys have all seen this picture here. Okay, this is what we're talking about, flattening the curve. We're talking about this big peak here. We don't want to have that big peak. That peak is when you exceed the resources of your hospitals. Okay, that's when you don't have enough ventilators. That's when people die because you don't have the resources. If you keep it under that, like we in Milwaukee, we've been doing a pretty good job of this. If you're under that curve, you can treat people. People are going to die, of course, but you can treat people, efficiently. You have enough resources to treat them. The problem with flattening the curve is this: when you flatten the curve, you spread it out, and that's the part we weren't ready for. That's the part they didn't prepare us for, because we were trying to get away from this, and we're here, which is good. But we're not ready for this long term. It's going to take a long time when you flatten that curve out. Okay, so the people that are going to get it, they're not going to get it all at once. It's going to take a long while for them to get it, but it's going to be a long time. So when we open things up, we're going to see that the cases are going to go back up. So the reason why things have gotten better is because of the social distancing that we've been doing. But we can't do that forever. We're not going to do that for a year. So it's going to take a lot of wisdom from our leaders in deciding when we can open back up and how we can do it safely. Now, the guidance that the government has given us is that you should have a period of time where that curve is going downward before you open things back up. Otherwise, you're going to keep going back up. And so we're not quite there in most communities. And we'll see what happens in Georgia, and some other places that have jumped the gun and opened up. But if things go like we anticipate, we're going to see a lot more cases popping up there. The other thing we know from the 1918 influenza pandemic was that there was a big spike of cases in the spring, and then it came back again in the fall, and it was worse in the fall than it was in the spring. And so we don't know what this virus is going to do. It's not exactly the same as influenza. We know influenza is not quite as deadly as this virus is. Influenza, for those who start off saying, "Well, this is just the flu." Well, the flu, we expect that if a person has the flu, 1 or 2 people around them will get the flu. Okay. With this COVID-19, we expect it's more like 2 to 3 people will get it from that one person, and it's more deadly. So last year in the 2018-19 flu year, we had 32,000 deaths. Already we're over 60,000 deaths with COVID-19. So it's a lot more virulent, so it's a lot more deadly, and it's more contagious than the flu. So we really can't compare it exactly to the flu. But we do know there was that pandemic, or that double spike with the past pandemic with the flu. And also the flu is still around. So we anticipate in the fall we'll start seeing flu again anyway. And so we add the number of cases of the flu plus the COVID-19 that's still around. We're anticipating some potential trouble there if we don't get a vaccine before then. So keep that in mind too, is that
can you tell me about, can you go into, from the Cream City perspective, what are some of the things you all are doing to increase awareness and also help with additional testing? We had a question from one of the attendees who asked about not being sick enough to get tested. So that was the question.
Yeah.
And I understand the sentiment. It's like everybody, there's not enough tests right now to go around. If you feel like you need to get tested, what are we doing as far as testing is concerned? How can we increase the number of tests? And maybe the Congresswoman can join in if she has any insight on that about additional funding for testing from the federal level.
Yeah, that is a huge problem, and it's unfortunate that we weren't ready for this. I mean, little things like when we do the test is a swab that goes in your nose. Everyone's had it, but no, it goes pretty far back in your nose. It's a swab. It's a fancy Q-tip. We don't have enough of those. How long does it take to make a Q-tip? I don't know, but we don't have enough of those things. We don't have enough masks. We don't have enough gowns. So those are little things that are hindering our ability to test people. It would be ideal if anyone who was sick, anyone who had a suspicion that they had COVID, would be able to go to their doctor, go to a community health center, and get tested. But we have limited ability to do that. Now, there is an effort now to open up the community health centers, and they can now test people that have symptoms of COVID. So everybody can't just go. You gotta have symptoms. So you have that fever, shortness of breath, cough, those symptoms, or exposure to somebody. So if someone in your household has known COVID, or your coworker has a known COVID infection, you can get tested. But we're not just testing anybody at this point. The next phase is going to be, though, we're going to start testing antibodies. Okay, those tests aren't yet available, but we'll be able to do an antibody test. That means that we can check your blood to see if you have antibodies in your system against the virus. That means, and presuming that you've been exposed to it, you gotten over it, and now you're immune to that. They can use some of that for people that are in the hospital. They call it convalescent antibodies, where they can take their immune system and transfer it to somebody else to help them fight the infection. That's not something done for general population. That's really for people that are really sick in the intensive care unit. So but right now, we do not have the ability to test everybody who wants or needs to be tested. Definitely not everybody who wants to be tested, but we're trying to get to the point where we can test everybody who needs to be tested. That's a problem. And the other thing too, as we open up, another thing that our leaders need to know is that when we start going back to barbershops and beauty salons and things, we need to have some way that they can protect themselves. and they can protect us. So if I go get my hair cut and my barber doesn't have a mask or doesn't have a mask for me, I'm not going to feel safe going back to the barber. So we need to have ways that they can also get that PPE, because it's not really available for anybody. Healthcare workers, much less people that are working in in the grocery store and other places. Here, the police don't have they don't have masks and things, so they're coming in contact with people. The paramedics, there are a lot of people that are out there that really are kind of high risk and don't have PPE.
Absolutely.
Yeah, I guess I could just jump in really quickly, and I saw that Dr. Arona Williams wanted to expand on this subject too. I just want to say that Dr. Izzard is so correct. We weren't prepared for this, because we should be able to do broad testing. If we were able to test broadly, we'd be able to open the economy a lot more quickly. We'd be able to find those people. There's a bill that's going to be introduced tomorrow by Representative Bobby Rush that I'm going to be an original co-sponsor of. It's the TRACE Act that really will provide $1 billion actually to really identify, find people, isolate them, so that we can really move the economy forward. I guess the point that I want to make is that we are about 6 to 7 weeks behind the ace ball, because the president of the United States was in denial about this pandemic. He was warned in January that there was a pandemic in China. He was warned through the intelligence agencies that the Chinese were not being forthcoming with information. He was warned that it wasn't just a little sickness. And so his response was to close the borders down January 31st, but then let everybody else from Europe come in. He had this notion that we were going to be able to just contain it in China, and it was very naive of him. And of course, that didn't happen. We had 40 people, I think, about that came in from China who were infected. And then we had the floodgates from Europe still coming in as well. In addition to that, private companies sent 17.8 tons of PPE to China on February, like the beginning of February, at a point in time when we had already had diagnoses of coronavirus in the United States. That was the extent to the denial. And so right now we see China sending us all kind of PPE. Well, they're sending us, we sent ventilators over there. We sent masks. And under ordinary circumstances, you don't mind, being generous, but it was an act of denial that enabled them to do that. And so, yes, we're scrambling for PPE. And if everybody can't get a test, that's the last point. The president does not want to enact the national defense strategy where he can just, those swabs that Dr. Izzard was talking about, just tell the makers of Q-tips, you will now make swabs to this, to this specification so that we can use them. You will do that. And he won't do it because he's being told by the Chamber of Commerce that they love private enterprise. They love being able to price gouge. They don't want, Scotchgard doesn't want to hear that they now have to make masks, and masks that might cost, 50 cents a piece now cost $8 a piece. And so we are really losing more and more and more time on this plateau that Dr. Izzard talks about, and on preventing us from falling into an all-out depression, and and of course a second surge, because as so many experts have recognized, is that the second surge is more deadly than the first. So this is going to be a long haul, y'all. I yield back to you, Senator. Representative.
I wanted to just go to Dr. Aronica Williams, who's here from Milwaukee Health Services. She wanted to talk about testing briefly. So Dr. Williams, can you talk about testing, and then we have you on the schedule to come back again, Dr. Williams, before we end. Okay. So I wanted to go to you quickly to talk about testing and what that means and the process, and give out the number to Milwaukee Health Services so we can all come visit you.
Okay, so thank you for having me. So I wanted to expound on the topic of testing. We were going to get to it a little later, but again, because as the conversation is very fluid, I wanted an opportunity to jump in. So there are several health entities that are offering COVID-19 testing. Now, as you're aware, I represent Milwaukee Health Services Incorporated. We have two locations, one on 82nd and Silver Spring, and the other one on Dr. Martin Luther King Drive and Clark Street. Now, our clinic has been able to test our patients who present with symptoms indicative of COVID-19 for almost 2 months. However, due to the paucity of testing supplies globally, that's what Dr. Izzard was talking about, the testing that was offered initially was only offered sparingly. However, in the past few weeks, our clinic, as well as the other area federally qualified health centers, those are, so of course, Milwaukee Health Services, Outreach, Progressive, 16th Street Clinic, and Gerald Ignace, we have all been able to expand our testing ability and offer testing for patients with symptoms. So again, like Dr. Izzard mentioned, for patients with symptoms who are seen and evaluated by one of our providers. So this is not just anyone. Representative Bowen talked about a couple years ago, he didn't have a primary health care provider. So that's what community health centers are designed to do. We're designed to be that catchment provider for people who may be uninsured and those people who are unattached to a healthcare entity. But for those patients who don't have a primary care provider, we're able to see them. We're doing virtual visits. I'll talk a little bit more about that later. But through the evaluation of one of our providers, patients who have symptoms are able to be tested. And so this is a wonderful opportunity for the patients that we serve on the north side of Milwaukee and the Milwaukee residents on that side. But as a collective effort, all of the federally qualified health centers in the Milwaukee area have expanded our testing capabilities in order to be able to serve Milwaukee residents.
Thank you so much, Dr. Williams. I appreciate it. I want to, at this time, just wanted to check, is the Lieutenant Governor with us yet? No? Okay. I want to kind of pivot a little bit to talk about education. Education is very, very important. We know that education is a big part of our economy in Milwaukee County. We know that education is also a big part of everyone that has a child. You have to go to school. So we need to figure out how our education system is working. Okay, I'm sorry. Before we go to you, Director Herndon, I see that the Lieutenant Governor is here. He said he raised his hand.
Wonderful. Great.
Just like he's in school, he raised his hand. Yes, I missed your hand, Lieutenant Governor. So if we can pivot to you right quick, to the Lieutenant Governor, to talk about some of the things that we're doing. We've heard from Congresswoman Moore about what's happening at the federal level. If we could pivot to the Lieutenant Governor to talk about what is going on with our state and talk about some of the items that are happening at the state level as far as where we are with our executive orders, the Badger Bounce Back program, and how we are able to continue to flatten the curve, as Dr. Izzard told us what that meant. And as we get closer to doing that, and how we can kind of move forward as far as public health measures are concerned.
1 second. I just my makeshift tripod of blue books just collapsed.
Those blue books are good for something, aren't they?
There we go. All right, I'm here. Thank you so much, Representative Myers, even though you tried to erase me. But I am very, very happy that you're putting this together. Very happy that you're doing this. A lot of information that just doesn't get out to people that needs to get out, and especially as it impacts our community in this devastating way, in this disproportionate way. As of yesterday, we had over 6,500. We're closer to 7,000 now, just over 6,800. Over 300 deaths here in the state of Wisconsin. But all this stuff has been talked about and how those numbers disproportionately impact Milwaukee and specifically the Black community. The disparate impacts, as was stated, there's not something that makes Black people more prone to contracting coronaviruses. A lot of the systemic and social inequities that have already existed forever, the things that we have talked about since the beginning of time, or as many opportunities as we get to talk about it, and that is the structural racism that exists, it's the income inequality, it's the lack of access to healthcare and affordable healthcare. People don't always have a primary care physician. People don't always show up to a doctor if they're feeling sick because they don't know how they're going to pay for it. And there's also just the historic distrust of a lot of the healthcare systems, which is why building that trust between communities, whether it's low-income communities, communities of color, Black communities specifically, that's why building trust is so important and establishing that credibility. And we do need to diversify the healthcare profession also to be able to build those bridges in communities. And as a state, we have to first recognize those issues. And, so many people can get away for just kind of ignoring that this is happening. And I think that's always been the case. The stuff has just been swept under the rug. But the first step, just like anything else, is acknowledging that problem exists. I mean, you look at something as simple as Badger Care expansion, making sure that, the 80,000 or so people would have had access to health insurance, those people that don't. I don't think that, it would be difficult for me to think that all 80,000 people who would have been eligible for Badger Care who are not, it would be, I don't presume that they went out and bought private health insurance just because the cost of people are on the margins. And if you have to decide whether you're going to be putting food on the table, whether you're going to pay rent or health insurance, chances are you're going to pay your rent or buy food to put on the table. So that creates a huge problem for people. And you have to think about a person that may have been in a position to have better had their health addressed, but wasn't able to because of that lack of health insurance. And I think that this has exposed a huge flaw that we do all along that existed in healthcare in America. We need to move towards a more universal system because what we have is just not working. I mean, over the last couple of presidential debates, people debated Medicare for all, public option. What should we move towards? And, the argument of a person liking their health insurance, that's a myth. No, I have health insurance, I have good health insurance. I don't love it, right? I love having it. That's the difference. I love having health insurance. And unfortunately, we are in a position where we have to love the idea of having health insurance. But the people that lost their jobs, the millions of people across America, the tens of thousands here in Wisconsin, these are people who had a job and presumably had a healthcare plan that they were satisfied with. And they probably assumed that they could keep their health insurance, but they didn't realize or were not able to predict that they were going to lose their jobs. So therein lies the problem. And the historical issues that we've been dealing with are only being exacerbated with the spread of COVID-19. And, in these kind of moments, people have to lead. And it means being forward thinking. And just because you reopen the economy doesn't mean the economy. And I don't even say reopening the economy anymore, because what is it? It's showing that the economy has been broken. The economy is open, but the flaws, just like in everything else, like in healthcare, like in income inequality, these flaws have been exposed. So reopening the state doesn't mean that the state is going to recover right away. If you can open up every restaurant, every retail store tomorrow, it's not like people are just going to start showing up. Some people will, but it's not like that's what's going to save our struggling businesses right now. So that's why we need a measured approach when it comes to getting us on the other side of this pandemic. But that also means that we have to be safe and responsible in doing so, because we can do both and we have to do both. This is a responsibility that we have as elected leaders. But it means coming to the table and negotiating in good faith. It means talking about people who have been the most impacted. And that's what's the most disheartening thing for me is that, the majority party in the legislature, the speakers and the majority leader, they talk about wanting to get things open quickly, but never have they talked about the tremendous loss of life and how do we stop that from happening? How do we stop this tremendous spread that's happening? And how do we stop this rate of death that's occurring in Black communities? That has been absent from every statement. And you even get people who say, well, this is a Milwaukee issue, it's a Madison issue. Well, you are a state legislator. That means you are responsible in some way for every part of the state. Even when I was a state representative, every vote that I cast had a statewide impact. It mattered what went on in other parts of the state. And I don't know any of us from the Milwaukee delegation or Black Caucus that can ever get away with saying some of the things that they say. We can never look at a part of the state. We can never say, oh, well, that's just a central Wisconsin issue. We don't have to worry about that. And nor should we want to. That's ridiculous. Why even want to be in the legislature if there are parts of the state that you are ready and willing to write off in that way? But all that to say is the regional approach that's been floated around sounds okay in theory,
the part
right? But
that makes the most money for you, right?
Right, and it's, but like the regional approach is in theory, it sounds like something that could work, but it will be ridiculous in practice because how can you have one part of the state open if people are living in an area? There's nothing that separates them. It's not like these places are walled off. You just get on the road, you drive there, you go there. So what will stop people who are potentially infected from going to parts of the state that are seeing lower rates of infection and lower rates of transmission, especially the people who are transmitting through while being asymptomatic? And since the first safer home order, we know that lives have been saved. We have beat the models, we beat the predictions because we took the approach that we've taken. Now, I wish as a nation, I wish we could have been more proactive. But like the Congresswoman said, the president ignored the reality of what was going on. He tried to blame it on other countries and think that we would be immune to this, which couldn't be farther from the truth. And you look at even in the UK, somebody like Boris Johnson, who is a Donald Trump lateral, right? He understands the severity of the situation. He is not ready to open back up the UK, given the threat that COVID-19 presents to that nation. And we are in need of leadership at the federal level. I'm thankful that we have people like Congresswoman Moore who are there. I'm thankful for the majority in the House of Representatives to at least be there to stop some of the worst things from happening. But it's important for us in any recovery effort to make sure that we are helping the people who actually need help and not just the people who get help all the time and then point fingers at the people who need help. We see the largest companies come away with, come away on the winning end of all these issues, and it happens every time. And when we talk about income inequality, a lot of folks think of it as wealthy individuals and not wealthy individuals. But at the same time, you look at these large corporations versus small family-owned businesses, the ones that have been keeping communities afloat forever. The small businesses where the owner lives in a neighborhood, where you have a relationship with people, with those who actually care about the neighborhoods that they serve. So we have to make sure that we, are putting people first who are actually in need, people who have been bearing the brunt of social injustice even before the pandemic. As a state, we are working with the local health department, sending over 100 contact tracers to Milwaukee, and they've been able to increase those numbers to support the health department so that we can help, stop the spread. Department of Health Services and the National Guard have been coordinated with 5 different community health centers in Milwaukee to set up drive-through testing. We announced that Monday for anybody who's enrolled in, for anybody who is an enrolled patient, or even those who don't have a regular doctor, those who don't have a primary care physician. And we also work to complete the alternative care facility at State Fair Park to prepare for a surge if necessary, if local hospitals become overwhelmed. And that's a protective measure. That's being proactive. I'm hoping that we don't need it, but we have it just in case. And it will be far worse if we end up needing that space and we didn't have anything constructed. And we also extended Safer at Home because we knew that reopening, today's the 30th, if we reopened a week ago, it would have been far too soon. Today, I want to say there have been 334 4 new cases between overnight, between yesterday and today. And that is our largest single day spike. And we've been seeing these largest single day spikes in the state. If we had opened up the state or a week ago, that number would have been much larger than 334. Because the people who have contracted, the people who have been infected, still stand a chance to spread the virus. Like Dr. Israel said, a person who's infected is likely to infect another 2 to 3 people. And we know that most vulnerable communities are feeling the brunt, the economic pain, economic hardship. And it's unfortunate, too, when you see people like the Speaker of the Assembly talk about, some people are making more money on unemployment than they are at a job. And there are some states that have proposed, people on unemployment, if they don't go back to their jobs, they lose unemployment or something like that. I don't know people who decided or chose or volunteered to get laid off. And even the people who did get laid off, right? And there could potentially be people who maybe make a little bit more just given the $600 boost, but you got to think about people who lost health insurance. COBRA is not cheap. And so technically these people are not making more money and they lose they lose the benefits that they had with the employment that they've had.
So,
but the Badger,
I want to ask you this question. We had a question, actually 2 questions that came up, and then a question from myself. So the first question that came from the audience is public health and private enterprise on a collision course in this state, whereby paycheck workers, so that would be, I guess, hourly employees, will be forced to go back to work and be, I know we have the lawsuit where the Republicans are trying to sue the governor. I think that decision, amicus briefs were due today, in that particular case. But this question says, is public health and private enterprise on a collision course whereby hourly workers will be forced to go to work or be denied unemployment benefits? That is a very good question, because if the business that you work for is allowed to be open and the employee refuses to go because of COVID, what would be a stopgap mechanism in that? Would that be something legislatively that we have to deal with, or would they have some recourse to be able to say, no, I can still qualify for unemployment?
Let me just chime in on that and say, if a local community is going against the governor's order and choosing to open or to allow businesses to open, then basically people in that community, will they be denied unemployment, since arguably they should work?
Right.
Because their community and their employer, have said so.
Absolutely. So that's the question that we're asking.
Yeah, I mean, so even let's take it back. So you mentioned the cross between private enterprise and public health. I think that Green Bay is a perfect example with the outbreak at the meat processing plants, and the other ones across the country, and where we see a potential hotbed for spread of the virus. You saw the president issue his order to keep them open. And, I think that it is important for us to, we would need legislative change, but you have issues like that where the president can just overrule the smart decisions, the smart but difficult decisions that were being made. So that's one of the things where it's a bridge that we will have to cross if we get there. And, I hate to put it that way, but even like with the governor saying, trying to move the election back, they took it to court. And right now, I am just not confident in what the courts would decide. Like, yes, would it be a legislative decision? I think ultimately it'll come down to the courts. And that is where I have very little faith in what our state Supreme Court and how they will rule at this moment.
Okay.
Representative?
Yes.
This is Senator Taylor. To go to what Lieutenant Governor Burns just stated, when I requested an LRB memo to ask whether or not the state or the municipality would be able to be sued for forcing the election in a pandemic, it seems that there may be some challenges for liability for the state, but definitely that there's room for liability potentially for municipalities. So I'm not certain, but the same thing may ultimately come into play, but we need to look into that in regards to what benefits would be, would be available to people, because their local community, the people they elected, are saying they shouldn't have to get it because it's time to open. And I think we need to make those arguments, because you can't have it both ways. You know what I mean?
That makes sense to me. Makes perfect sense to me. Congresswoman, did you want to say something?
Well, I think, unemployment compensation is a state-run program. And we ran into this buzzsaw when our state law was that people couldn't get that first week of unemployment under our law. And so thank God the legislature that you guys finally did that. So it occurs to me that the state legislature may have to do something. Now, what Senator Taylor raised was very interesting, that if the local community, like Shorewood, for example, or the city of Milwaukee says that we're not open, then can someone who is domiciled, can a company domicile within that there overrule them based on some politics? I mean, I think that it might be worthwhile for us to protect ourselves through local initiatives like that, and to say, just maybe have the Common Council say that that we will be taking orders from the governor versus business owners. I mean, it seems to me that they shouldn't be able to overrule.
Can I ask a question, Representative Myers?
Yes.
What jurisdiction does the public health commissioner have during an emergency? Is it their decision to decide who can open in a municipality if a overarching state issue has already been determined? Like if a business wants to open up in Milwaukee and the state has said there's a stay-at-home or safer-at-home order, does the public health commissioner's jurisdiction come into place when a business wants to open?
That would be if the governor has already declared that that's under the auspice of the DHS, and Senator Taylor can tell me if I'm incorrect, but I do believe that the state law would be the dominant force over a county and over a city health commissioner. So therefore it would have to come from the state. For that, the commission would be from the state. And if the state says no, then that would be going against that particular, the order.
I think you're correct. I think to go to the supervisor's question, though, I think that because the governor has said we moved into phase 1 and gave some leeways, we have to, I guess, narrow down what leeways have or have not, been provided, so that if, for example, dog groomers can now open their business and that dog groomer happens to be in Shorewood, and they're able to do that, then the governor has approved that. If it is a business that is not that type, let's say a business that's opening in Defiance, and their community did not police that, then I believe that community has the liability because they deviated from the governor's order. So I think it really has to be based in what exactly is the order, and whether or not they're deviating from it, and if so, where the authority came from. Did it come from their local municipality not enforcing it, or did it come from the business, the business themselves or the governor?
Absolutely. I think that's absolutely correct. So thank you for that clarification, Senator Taylor. Lieutenant Governor, did you have anything else you wanted to share with us?
I got a million things I can share with y'all. We'll leave it here for right now. I appreciate everything. Thank you for putting this together. Thank you for Congresswoman for everything you're doing, and thank you, Dr. Iser, seriously, for being such a valuable resource. everybody else, Dr. Williams. You know, you got your violin today. But no, I appreciate everybody on the call. This is going to be very important. Make sure that do all that we can.
Thank you, and I'll make sure that the staff that's listening, Katrina and or Kenya, if you could post the graphic from the Badger Bounce Back program, make sure that individuals understand what the phases are. We can put that in the chat so that that will be our attendees. That will be helpful. So thank you again, Mr. Lieutenant Governor.
Before the Lieutenant Governor goes, can we ask one quick question of you, Lieutenant Governor?
I'm listening.
Thank you. On the issue of the unemployment compensation, the administration has been very responsive to the issues that we brought to them. One of the things I'd like us to consider is having the National Guard help with maybe the intake or something of the unemployment claims, because there have just been so many that have.
Yeah, it's been a lot, and so part of that too is an issue even around really outdated software that we're using. But we have hired some new folks to help process some of those claims. But yeah. I think I get it.
Thank you. I hear you.
It's even hard, like even just onboarding people right now. You know what I mean? Like getting people in, interview new staff to hire. Like it's just not a good situation all around, and hiring new staff. I can imagine how difficult it is while trying to social distance, bringing on a whole new team of people.
Thank you again, Lieutenant Governor. So much. As we begin to pivot, before we go to education, I know that's a very important topic and we all want to get our questions in. I want to repeat again, for those of you that are attending or listening by phone, that if you need assistance in real time, we do have staff that are available to help you. You can give a call to 608-266-5810. Once again, 608-266-5810, or you can also call 414-342-7176. Once again, 414-342-7176. And if you have issues or need guidance as far as unemployment, how to file for unemployment, how to file for food share, how to file for any of these services that we're talking about that are state related, we do have staff that are available to help right now. So they're able to help you with these instances right now. So you can also call. Also, don't forget to put your questions in the chat box. We are reading the questions. So I know some people I got a lot of education questions. So we're right on time with Director Herndon being with us.
Representative, before you move into education, if we could just also list the Congresswoman's information, so if people have questions about their stimulus, that they could go directly to the federal level, so that we don't have to be the go-between?
Yes. So Katrina and Kenya are listening. So I know they put the IRS link so that you can see where your stimulus check was. That is already in the chat. You could also post Congresswoman Moore's office information in the chat feed. That would be helpful as well. So thank you, ladies.
And if people would mute their phone, it would help with the back sound.
I think everybody muted. Just check. Okay. All right. So we have with us Director Marva Herndon, who is my school board representative from District 1 for Milwaukee Public Schools. Thank you so much for being here with us, Director Herndon. We have a couple education questions, but before we get into the questions, I wanted to just pose this question to you. So school buildings are effectively closed for the remainder of the school year. What has MPS done to ensure continuity in learning? So I will let you take that question and tell us all the things that they possibly have done to deal with the community as far as relations, as well as to ensure continuity in learning.
Good afternoon, everyone. I'm so happy to be joining in with you today. And yes, education is a hot topic. In terms of what we've done, like every other level of government, we've operated behind the 8 ball to a degree from the very beginning. And now we're playing catch up. And basically how we've been communicating is we started out with, first of all, taking care of the most important needs for the students, which was food. And we all know that many families depend upon the breakfast, the lunch, and in some instances dinner that the school district provides. So we had to set that up, and the school, the teachers, all of the staff stepped forward in a very, very positive way, in some instances, putting their own health at risk to make sure that these things went well. And that was our first line of communication, was the food services or the food distribution program. And at that, we were also handing out educational packets. And that was done by grade level, which is answering some of the questions you had for the agenda as well. The other thing, the education packets, administrators were there. There were social workers available, and there were some teachers, but at that particular instance, it was dependent upon the parents at that point in terms of the education that was really going on at the initial phase. Because we, as a district, we had to purchase the Chromebooks. We had Chromebooks, but not every child had a Chromebook. The other side of that coin, that was a real problem, was making sure that all the parents had internet access, which, although that is not something that is provided by any school district, possibly, it definitely was not provided by the MPS school district. So we had to get with partners and try to find funders and try to work with Spectrum and other providers. We had a lot of work to do to try to make sure that those that did not have internet access, we had to work to make that available. And that is an ongoing project, to be honest. But in terms of the Chromebooks, all the students have the Chromebooks. The teachers have already had the responsibility of connecting with their students, and where there's fall through, in fact, I had a couple calls today already, where there is fall through, we jump on that right away to make sure that these parents get connected. But I also am learning from some of the parents that the downside is some of them are not capable of doing this, and they don't know how to be a teacher in the home. And so the district is going to try to step that up as well. That means that the parents are going to have some assistance to help them through. They didn't sign up to be teachers. And then on the other hand, we have teachers that didn't have the technology capabilities, and we had teachers that had never done an online teaching session before. They stepped up to the plate, and they've had to go through training, and we're turning them out, and that's being taken care of. So the district, in my opinion, and in many of the parents' opinion, and those that I've been in contact with, for the most part, they're very pleased with what's been provided. It's simply that they didn't sign up to be teachers. And for those that haven't gotten their Chromebooks, the Chromebooks are available, but we do require that a contract be signed by the parent or the person that the child lives with or whatever, because that's real important. Those Chromebooks are not free. We know that many of them perhaps we won't get back. We're already preparing for fall. We do have the Chromebooks available, and we're going through the processes of trying to contact the parents in person. If they go to the food pickup sites, they can get the paperwork there, the contract there. They can contact their child's school, contact the principal. It has been online. We sent out Facebook messages, we had radio announcements, and then we also sent those surveys home in the mail to the parents. But we've not still, there's still parents that did not get the information, and so their staff that's reaching out to them to make sure that no child is left behind. But to our knowledge at this point, all of our students have received Chromebooks. They should be receiving information from and contacts from their teachers. And another thing that goes in line with that, which I mentioned before, was the providing of the breakfast, lunch, and now we are including snacks for the student, and the parents can always connect with staff when they go pick up those items. At this point, we've got 25 sites open, and 21 of them have already been open through this whole process. We've expanded it by 4 more additional locations as a food truck. And those 4 locations are at Bruce School and Fletcher on the northwest side, Holmes on the east side, and Maple Tree on the northwest side. Those are food trucks, and they will be at those locations providing the same services that I've spoken of prior to this. Are there any more questions?
Yes, ma'am. I know that there was a question from the audience, and I think the staff has posted information in the chat box where it talks about internet for indigent families. So we have opportunities for families. If you know of a family that needs help with internet access, and I'll get to the question that we had from the audience with this, that those 2 links are there, one for Comcast and one for Spectrum, to offer internet service for families that may not have access for low-income families. That is there. However, the question was, they heard that, and this may be a question more so for me versus you, Director Herndon, what was the school, is MPS working on a plan to give information about, about clearing your bill? That is something that we found out when we would give this information to individuals if they had a prior balance with one of the internet service providers, that they were being denied the opportunity to have the low-cost internet service in their home. So to answer that question, that is something that the Legislative Black Caucus is working on. The preferred information to the Public Service Commission to deal with that, to figure out a way to wipe that bill from that family and for them to be able to take advantage of that. And I can give you updates on that. So I will reach out to the person that asked that question to give them more information about that. But I did add the information in the chat box about that. That is something that we've already talked to those providers, or we're talking to those providers about with the internet access. Another question that we have for Director Herndon was, you talked about Chromebooks. If there would be a parent who missed the information about obtaining a Chromebook and their child is still in need of a Chromebook, is there a number to call, or should they call you, or to figure out how to get their child? Where should they go?
Okay, I have 2 hotline numbers. One is 414-475-8900. And that is a number for general assistance, just as you described, Chromebooks, on internet access, or what have you. And the other phone number is 414-475-8393. These are 2 hotlines that are serviced 8 to 5, Monday through Friday. The other thing is that a parent can contact the principal of a school and leave a message if they don't get them directly, to let them know, the name of their child and where they go to school, and they'll be in contact with them and get the proper paperwork signed.
Okay.
That is not shut down. That is ongoing. They can call me. My number is 651-6340.
Okay.
Dr. Herman, can you make sure you repeat where those food truck locations are located?
Okay, the food trucks are located at Bruce Elementary School, which is 6453 North 89th Street. Fletcher, which is one of the closed MPS buildings for now, that is at 9500 West Allen, which is on the very far northwest side, north of Round Deer Road. Holmes Elementary, which is 2463 North Buffum. And Maple Tree, which is 6644 North 107th. Okay?
And we also have the map, I believe it is, in the chat box that talks about where all of those food locations are. So
there has to be a link that you can just put up so that people are able to go, because I don't know that people would have gotten all of that.
Yes.
Well, this is all on the website, and it has been sent out. And I know for myself, I have posted and reposted, but I have to admit that, and those of you that know me, that I've always been one that was trying to keep up on everything that was going on with education. But we have to recognize that the whole community doesn't necessarily operate like that. And that's one of the reasons why I don't think people's first place to go for information is the Milwaukee Public Schools portal. But everything is there. There's a link on the portal right across the top that says something to the nature of COVID, and it's usually in red. And if they click on that, all of this will pop up, everything that's related to the shutdown.
Okay. All right. Another question is regarding high school seniors. How has COVID-19 affected their graduation status, or for the underclassmen, the number of credits for underclassmen that they've earned? So if you could answer that question.
Okay, let's start with the undergrad first. Or any of the students in the district for that matter, but dealing strictly with high school, at this point, they will be evaluated on their grade status at the time of the shutdown. Okay. And they would be given a pass or fail. In terms of the graduating seniors, I understand that we've got approximately 5,000 students that should be ready to graduate, which is very exciting. And there will be graduations, but we are allowing them, or the students in each of the schools, to decide what their graduation exercises will look like. And they have some options. They can do it at the school, but of course then we would not have very many attendees there to cheer them on. So in each case, the students will have that information, and they will be a part of the decision-making process of how their graduation exercises will be held. There will be cap and gown. It may be remotely video, but that will be determined by those in each school. The other thing is, in terms of their grades, the staff is working very closely with the students. The social workers and all are working very closely with the graduating seniors. In fact, they've been working with the graduating seniors for a while as up to this date, trying to make sure that they met all the graduation requirements. If they needed special assistance, that is being provided as well. So we expect to have that, but it won't necessarily be in June. It may be in July. And a lot of that depends on what the state decides. Right now, we cannot be in the buildings as such. And that is, of course, a big problem. So that has to be resolved. But there will be graduations, and the students will decide that. And let me see, what else am I missing here? In terms of the students that are taking advanced placement courses, there their social workers and their teachers should be working with them to make sure that all of that happens. And what we're doing in relation to this is decided and worked on, and we have to give Dr. Posley kudos on the work that he's done with Great City Schools and sharing best practices between all of the hundreds of other school districts that are facing the same issues that Milwaukee Public Schools is facing.
Thank you. There was a question that came from the audience that asked, just a moment, is their understanding that the school board is working on providing mobile hotspots, i.e. school buses being driven into neighborhoods for those who are unable to gain internet access? Can you speak to this more directly?
I can speak to it, but not more directly. Yes, that is not just a rumor. The district is working on that. The other thing is a funding issue, of course, and the district is working with partners to try to make that happen in some way, shape, or form. But, I'd like to remind everyone of something, those of us that are old enough to know, and that is when the city of Milwaukee first got Warner Cable, first true cable company coming through. They were, as part of their, apparently it wasn't a part of the contract, or they broke it or something, but they had promised that there would be citywide free internet services within reason as part of what they offered the city if they would be provided that contract. So it's very ironic that we bring it up today. Spectrum bought Time Warner out, but the way Spectrum advertised that they were making services available for parents for 2 months to help them through this, and then they put the curveballs in that, which I think is totally wrong. But yes, the district is looking at every possible way to make sure that the parents do have internet, and the district does have some hot spots, and the ones that they've got, they're giving them out.
Okay. One last question that I did have dealt with loss of instructional time. So this question came from Maddie. Maddie said, how will MPS work to make up for lost educational time? I know that districts like Waukesha started remote learning the first day that schools were closed. Will the final day of school stay as originally scheduled, or will learning continue into the summer?
Well, one thing for sure, unless something changes, the students will not be going back in the building, but summer school is already planned and scheduled, and all of that information will be coming out. We recognize that this was as disruptive for our students as it was for others too, but on the honest side, I have to say that when you've got a large urban school district that has been defunded for so many years, it's not easy for them to have provided these services over the past 30 years or so. It's not easy for them to get where our suburban counterparts are right now, but we're making it happen with the assistance that we've had from the community and the help from the community and the Lord, of course. We're going to get through this, and we're doing that. So in terms of summer school, there will be a June session and a July session. The district still cannot be in the schools until after the end of June. I think the date is June 30th. And for July, we're in hopes. Don't know what it's going to look like, but we're in hopes to get some of the students back into the buildings, and administration is working on how they're going to piece that together and still follow the safety rules for health. And it's possibly going to be mandatory for July. Okay.
One of the things that I also know, and this is to answer the attendee's question as well, there was a waiver that was put in place so that the school year would not be extended. So that is something that happened. So with DPI doing that, because this was a health pandemic, that is a possibility as well. So that has already been in place as far as I understand from DPI. So that would not extend the school year. So it's kind of like you build in snow days to your calendar.
Right.
Exceeded any snow apocalypse that we could have ever had. So, so the school district will not be penalized for those days. So the school calendar should remain the same. One final question that we had for you, Director Herndon, dealt with social emotional learning. Is MPS working on a plan to address meeting the emotional needs of students when schools finally open? Maybe counselors and social workers can develop a plan at this time to help facilitate that.
Yes, I can tell you that the district is working on that, and they're doing the best they can under those circumstances, even currently. But you run into the problems of the physical contact in some instances, depending on the type of IEP that the child has, because in many cases, you know, they need OT, they need PT. That hasn't been figured out yet, you know. But in terms of those that can do the video conferencing to reach out to students, that a lot of that is being done. You know, in fact, the teachers, or I shouldn't say teachers, but the social workers in that, they're working from home, taking their records home, you know, and handling it that way to connect with the students as best they can. But, you know, our community is also a mobile one, so they don't necessarily have, you know, hour after hour success, but the reach out is occurring. The administrators for every school is responsible for making sure that the staff execute the same responsibilities within reason now that they would have been expected to do if they were physically in a building.
Okay, wonderful. There's a question regarding 8th grade completion. How can we ensure students will graduate on time? She answered that question. I'm just going through to make sure that we got all of the questions for you. So I'm just checking the chat right now.
Okay, thank you.
Absolutely. Una Vanderval, please note that Friday is the start of Child Mental Health Week. Yes, we will be talking about mental health. So those social emotional learning questions, and put the website there regarding the mental health services. I think we answered that one. The food map is also in the chat box. And you briefly touched on special education. Talked about that in the last question. And we also have one dealing with homelessness. So what about the use of buildings for homeless kids and families? Any efforts to expose the young people, and this is a Senator Taylor question, it has to do with urban ag. Okay, so the first question was really about using the buildings for homeless families, possibly to allow shelter during this phase. So
you're breaking up, so I'm not hearing everything you're saying. You're breaking up, but I can tell you in terms of our homeless students, they are not left behind by any means. There's a special reach out that's being executed for those that the district is aware of. The thing that came to my attention this week, though, was that not only for the homeless students, but for students whose home life has been disrupted, and they may not be homeless, but they could be living with another family member. There's a disconnect there that we're working on as well. So basically how we're dealing with it is, should we get a call, such as some I've had, all the directors are responsible, you know, for doing the same thing that we would do under any circumstances regarding what district, and that is if we get the calls, we make sure that individual or that family is connected with the services that are appropriate for them, or the contact that they need to get to make these things happen. But no, our homeless students are not excluded. But the biggest problem is, like I said, phone number changes, family living location changes, you know, so where the teacher knows that perhaps they did home visits at a particular home for a child, and then all of a sudden that child has been uprooted, perhaps gone to live with grandma. The district does not know that. So we know that there's some falling through the cracks in relation to those types of situations. But that's the reason why I'm asking that everybody reach out to someone to provide any of these phone numbers that have been provided, contact any board director that you know to share a situation that maybe has not been addressed for whatever reason.
Do you have vacant buildings?
Do we have vacant? Oh yeah, the city has the whole list of them available for sale. And I most recently saw where one, I think it's down around the Wisconsin Avenue area, that is being has been purchased by a private investor and should be converted to housing.
So
but yes, the city of Milwaukee maintains the list of MPS vacant buildings. The city owns them, they control them, and when they're empty, as you probably already know, the state put forth strict guidelines as to how those buildings can be sold. So the one downside is the requirement, and I think it's the first 2 years that the building is on the market, it can be sold to no one other than a charter or a voucher school entity. And so that's the downside of that whole thing, because it cannot be sold to an investor for apartments until after 2 years have transpired.
I think like the Fletcher building has been sold, but my question is, now
yes,
you
ma'am.
have buildings that are vacant that are normally used for teaching, and I'm wondering whether or not there had been any effort to use any of your buildings for homeless.
You mean in terms of dealing with this pandemic, or what?
Yes, during this time. Since
you said for
them and you're paying for them and you don't have school based on the governor's statement. I'm asking whether or not, and I hear that probably not is what I'm hearing. And so I was just thinking might be a good way for use of the building, save even some, revenue, and help your children and families. And so maybe it would be something that could be considered. And the other question was about the urban agriculture piece. It was about, since you are only pretty much doing curriculum stuff and you're doing feeding the children in the community, are you connecting any of that work with the young people around urban agriculture and the apprenticeships that come with that? Are we using that work that you're doing as a opportunity for young people to get the credits that they need, or to make it teachable in that way? Are we doing any of that? Are we getting them engaged in that way, in any way?
At this point, my answer would be no, we aren't engaging them in that way unless they can be together safely. And right now, that is not set up. And I can't answer in terms of what the legal possibilities or responsibilities are, but there could very well be some, because the district has to take their directives from the Department of Public Education, DPI, as it's known. So I cannot speak for that. Of course, we have it available. I'm so proud of Vincent High School being in our district, and we've got a couple other schools that are working in ag as well. But right now, there's that limitation of being physically together, staying 6 feet apart, having all of that stuff. So that is a holdup that administration is working out. But if we were able to do that, we certainly would. I don't know if you know it, Vincent School has in spite of the pandemic, we've got plenty of little baby goats up there. I think it's 10 or more at this point. I can't wait to go up and visit the students with the barns. But right now, I don't think the students are allowed to be there. Okay. And the teachers' staff is handling that at this point.
Thank you.
Mm-hmm. I answer your question about the buildings because with the buildings, that same thing. The buildings that are available for sale, MPS
they don't
owns.
Yeah, I'm not. I do understand what happens with the ones that are for sale. I was asking about the need in the community and kind of marrying it all together, especially in this time that the buildings aren't being used. And so, and on the ag piece is something that I know that I've shared with the district quite a bit from a pathway to be able to generate revenue as well as a way to use apprenticeships. And I think that it's just an opportunity that we could seize to use in a more effective way, both to generate revenue and to prepare our young people. And so I know that it's something I've shared with the district before, but I believe in this moment, it's like shows how important it is, because it's one of the only things that we're still doing is agriculture, right? And it should be, it's the number one industry in our state. And I just, am trying to just make sure we're making that connection as a school district, especially since food insecurity is such an issue in our community, and how we can teach our young people through this pandemic, not only how to get access to food, but how that is also industry and it's training for industry. And so that's the piece that I'm hoping that we make that connection on. And so thank you for sharing.
Oh, no problem. No problem.
Hey, this is Dr. I have a question for the director. Can you hear me?
Yes, I can.
Yeah. So I know one of the states that maybe it might have been New York was thinking about was these playing with the idea of starting school early to make up for the time that the students lost. Has any thought about starting the kids in August or starting in July?
Yes, you might have missed my statement. School is going to be available starting in June. But that will be done online more or less because legally we cannot be in the buildings. July, we hope to be able to be in the building and actually have, the teachers and the students in the buildings, but we don't know how we're going to work that out if we still have to have the 6-foot separation to the extent we do today. But that is what's on the table right now. That's the plan. So in terms of starting school in August, I don't know if, when the students go through July, I don't know how long that will last. It could extend into August. I don't know what that calendar looks like. But that is the calendar, and maybe the students will not start in August, but start in September. I don't know. That hasn't been passed down in terms of the fixed dates because we still have to work through all the legal ramifications of having students physically back in the building, as well as what the governor's directives are and what DPI's directives are. But as far as our administration is concerned, it'll be probably online through the month of June, and physical in July. That's what we're hoping for.
So, Director, they won't be physically in the schools, you're saying, but they will be doing school starting in June.
Doing school starting in June, yes. In other words, more. They'll be perhaps trying to make up. It depends on the grade level. So it'll be trying to make up what they've missed, where, they'll have direct instruction, perhaps online for the full day and their full schedule. So it sounds like the responsibilities will then be taken off the parent, to sit there necessarily and make this happen. But that's June. And then July, it is the hope that the students will be physically in school buildings.
Oh,
but right now,
so excited because they have a whole different appreciation for teachers now.
Oh, you're absolutely right. And when I talk to parents, we don't understand. Many people don't understand. If you've got 3 children and one is in kindergarten, for example, and then you've got one in 6th grade and you've got one in high school, how does a parent manipulate that, those different grade levels, those different responsibilities, and all the teachers that go with it. And that's one of the things. And add this, each kid has a Chromebook, and the parent isn't technically savvy. Then what? So, the things that are holding this back is not all about the instruction. You got to think about those parents, or even if they're allowed to be home. What if the parent does some kind of work in their job consists of say working at a fast food restaurant, or in one of the big stores that are open, or a grocery store? Then who's taking care of that child's academics, even with what we're providing?
Well,
so that's no problem. Thank you.
Absolutely. So I want to briefly go to Representative Haywood, who had some brief update he wanted to give us. Representative Haywood, are you there?
Yes, good. It's 5 o'clock now, so I'm gonna say evening. Good evening, everybody. I am State Representative Kaylin Haywood. I represent the sensational 16th Assembly District of Wisconsin. That is downtown Milwaukee, then parts of the north and east side. Like Representative Myers said, I will be brief, but some things I want to go over. One, in the chat, you're going to see some information about small businesses. During this economic interruption, we're seeing a huge impact on small businesses around the state, and there's information available. So we're going to put that in the chat. But if you need more information or more help and support, please reach out to my office. We'd love to help. Also, big shout out to both Kenya and Katrina, who are doing a dynamic job in the chat with putting information out there to everyone. But yeah, so small businesses, if you need help, check the information out, but also reach out to our offices and see if we can help out. Also, housing is super important for me. It's part of why I ran for office, but also it's super important to everyone now. So I've had the honor of serving on the housing committee for the last term, and we talk about how to make sure everyone has quality, affordable housing. But in this time of economic distress, folks are worrying about how they keep housing. So there's a couple updates I want to give out about the current housing situation. In Executive Order number 15, Governor Evers prohibited evictions and foreclosures for 60 days. That is prohibited up until May 26th. I will be working with the governor's office in the coming weeks to determine if we extend that, because we don't want folks getting evicted from their homes because of the economic distress. That's what we're discussing now. But for right now, evictions cannot happen up until May 26th. Also, DATCAP, which is the Department of Agriculture, Trade, and Consumer Protections, has an emergency rule in place that does not allow landlords to place late fees or penalties on tenants who either are late on the rent or can't make the rent. So that's super important. That was done on April 25th. That's for 90 days, which gets up until July 24th. So if you are a tenant and you are struggling to pay the rent, you did pay late, and your landlord does tack on a late fee or any penalties, reach out to my office or any of our offices so we can help you out with that, because that should not be happening right now. Also, when it comes to consumer protections, price gouging is a thing that this environment kind of creates. It's demand's high for certain products, and supply is still limited. If you suspect price gouging happening, price gouging is when there is a unreasonable increase in price, usually about 15% more. Price gouging will be happening. Please call us so we can work with DATCAP and you to figure out, do an investigation, figure out what's actually happening, and do that. Some folks may think, okay, the price is a little higher, I can still pay for it. That may be true, but there are folks who can't pay for that and can't still get that good or that resource. So do it not only for yourself, but do it for others who may also need that good. So reach out to us. I want to talk about education and kind of our essential workers as well. My district is full of a lot of essential workers. Our district is full of a lot of essential workers that are low-income earners. I want to thank you all for going to work every day and being on the front lines and risking your lives every single day to make sure that we can keep moving forward. So thank you. But also I think it's important that we talk about those essential workers. They have families. Their families are children. They're in school still. Because they're out being essential workers and helping fight the good fight, they aren't able to be at home with the kids and homeschool the children. So I've been working with several community members around the organizations particularly Linnell Ramey from Mentor MKE. We're looking for mentors, for folks who are teachers who want to volunteer and work with students, or folks from the community that want to work with young people. We're looking for mentors to assist in that at-home experience. And, teachers, they're more than just educators. They're sometimes parents, they're sometimes counselors, they're sometimes the resources, they're mentors. They can't teach the students all one-on-one right now. So if you want to help assist and do some of the other work around mentoring and supporting young people, reach out to my office. We'd love to be involved with you. And then lastly, unemployment. Americans all around the country are filing for unemployment. Some not for the first time, but some for the first time. And there are folks who have reached out to us and they're struggling to get their claims through, or there are folks who don't know how to do the process. If you are having troubles with unemployment claims, reach out to my office or any of us so we can help you work with DWD and get that claim taken care of so you can get your unemployment so you can still make ends meet. And I think that is it for me. But yeah, please stay home, stay safe. If you're not doing it for yourself, do it for others. But please remember to stay home. We're fighting the curve. So let's continue fighting that curve by staying home and practicing social distancing. But thank you all for tuning in today. But yeah, if you heard any information helps out, if you want more information, reach out to my office and we would love to help out. Thanks.
Thank you so much, Representative Haywood. I did want to answer Dawn J's question. Yes, we do have a lot of information going into the chat. However, it will also be available on the Wisconsin Legislative Black Caucus website or on the Facebook page that we have. And you can also find the information on all of our individual Facebook pages as well. We will also consolidate the information and make sure that it goes. Did I just say that? Yes, I did. We may also consolidate the information and make sure that we have it in a centralized location as well. So each of us can have the ability to put this on our respective websites as well for the legislature.
And Myers, if you don't mind, two quick things. One, I want to address Jermaine's question about the dramatic increase in property values that folks are talking about this week. So I want you to stay tuned. We won't talk about it now, but we'll get more detail about it in the coming days. We are working with the governor's office on figuring out how do we address this issue. Is it a city thing? Is something we can do temporarily?
It's city.
So we're trying to figure out now how do we work with the city and what we can do. So stay tuned. I think I'm sending out a press release tomorrow about some information about it. So just stay tuned for that. And then the second thing I just want to put out there, we also have to think about evictions that come in the coming months after this is all over. How do we work with the courts in the state to figure out how do we treat the evictions that are related to the COVID-19 situation versus the evictions that are for the regular problematic or nuisance tenant? How do we make sure we don't treat those the same, make sure we actually are treating those the way they should be treated? So that's something we should think about as legislators and community members about how do we deal with that.
Thank you. And I was wondering, Representative, that might be a good segue to talk about some of the... Yeah.
Congresswoman, I'm sorry, just from a legal perspective, I wanted to address those things that...
Oh, I'm sorry. All right.
That the representative has spoke to about the evictions. So individuals should know that their landlords can still give them notice. Your landlord, you still got to pay your rent. The pandemic don't take the rent away, and it's not taking their mortgage payment away. And so if you could speak, Congresswoman, to whether or not the PPP can be used for individuals who are real estate owners, because tenants are not paying and they still have mortgages that are due, and mortgage companies aren't necessarily proceeding right now, but all that's going to come to just clogging the legal system in the end. And then last thing I wanted to speak to was the timing. So people need to understand that when the courts open back up, then the process for evictions, mortgage foreclosures, whatever those things are, those processes will begin. And people are still doing the necessary steps so that they can proceed when that floodgate, for lack of a better word to say, it opens. So I don't want people to think that there's going to be a massive, you don't have to pay rent, unless the federal government is going to give it to us, because the state government didn't even do anything except the bare minimum so we could get the federal dollars. Thank you.
Congresswoman, go ahead.
Thank you so much. And thank you, Senator Taylor. I think that was a very important intervention. I just wanted to mention the priorities of the Congressional Black Caucuses because we're very, very, very cognizant of the difference in the way that we've treated business and the relief that we have given to individuals. With regard to one comment that Senator Taylor made, yes, the PPP, if you're someone who has to pay mortgage or rent for your huge business that has 500 employees, you can use the PPP to pay your mortgage or your rent. But how does that help you? If you're the small barbershop, and it doesn't help you at all. And it doesn't help you if you're an individual homeowner. Our priorities for the next package is to require moratoriums on consumer and small business credit payments, including car notes, credit cards, personal loans, and small business loans. Right now, we have seen some merchants that have been willing to work with people on deferring these loans. We've seen people who are willing to put mortgage payments at the end of their loans instead of the first part of it. So people need to check and see what is available to them. We want to prevent the credit reporting agencies from using adverse credit reports during the coronavirus period. And we do want to create additional targeted immediate grant relief for restaurants, small hotel operators, small businesses. I was very disappointed by the trillions of dollars that we have spent on corporations. I understand that we didn't want the economy to collapse, but it was very, very disproportionate response. We have a lot of independent contractors who are self-employed, and we want to make sure that they get the unpaid leave and unemployment insurance. Even people who sing for a living in nightclubs, play the piano, all of those are employees. We're working really hard, and this is important in Wisconsin, to prioritize releasing incarcerated individuals who are at risk, and certainly to release all juveniles who have committed a nonviolent crime. So I'm hoping that might be some incentive for you guys to work that through the state legislature too. And of course, ballot access. I don't even have to explain to you all the importance in providing more resources so that overwhelmed clerk's offices can get these ballots and stuff back to us. The $1,200 a month payment is not enough. I have been working with other people on increasing these payments, but I tell you, just before I end, I just want to say that I think Lieutenant Governor Mandela Barnes said it earlier, that this pandemic has really exposed and elucidated the flaws in our economic system. It's a capitalistic system. We're not trying to change it from that, but the reality is that 70% of our economy relies on people spending money, which is one of the reasons we've been having such a fit to get $1,200 into the hands of everybody. I have a bill that I am really working on that expands the earned income tax credit, a known bipartisan solution that really doesn't just provide the earned income tax credit for those people who are poor, low income, near welfare recipient, but to the 40% of Americans that Reverend William Barber and Reverend Theo Harris, the co-conveners of the modern Poor People's Campaign, talk about. People who don't have $400 to meet an unexpected expense. I know that it's easily administered. The earned income tax credit is. The uptake of it would improve if this were, unlike like a universal benefit, an Andrew Yang proposal. It would not go to every single person. It would reward work to the extent that people work, is to the extent that we get back to some new normal. But it would provide the earned income tax credit for single people who earn up to $40,000 a year. That's not a lot of money in this current atmosphere. And to couples, up to maybe to $75,000 a year, and would provide them with those resources without the shame and blame, and without the high marginal tax rates that disallow people to get other services that they deserve. And so I just wanted to point those things out and let you all know that as a representative who belongs to the Congressional Black Caucus, that we are ever mindful of, if everybody else gets the flu, we're going to get the coronavirus.
Absolutely, Congresswoman. Thank you so much. So I want to move us to stick with our schedule as best we can, to go to Representative Sheila Stubbs and Supervisor Jeanette Braverman and County Supervisor Felicia Martin. We are happy to have them with us here today because, as we all know, 70% of African Americans that live in the state of Wisconsin live in Milwaukee County. That's not where we all live. So we are all over the state. And as the 8 members of the Legislative Black Caucus, we have to represent everybody that lives across our state. So whenever they need assistance, we have to help where we can. So I would like to start with Supervisors Braverman and Martin, and talk to them about what are they seeing at the county level. Supervisor Braverman represents Ozaukee County, and Supervisor Martin represents, I want to say, the 7th district. She can correct me if I'm wrong. The 7th district in Milwaukee County. So I will defer to them at this time, and then we will follow up with Representative Stubbs, who, while she is a state representative, she is also a county supervisor in Madison. Or in Dane County.
Can you hear me?
Yes.
Okay, great. Well, first of all, thank you so much for organizing this significant event. Representative Myers, this has been so educational and insightful. I love that you've brought us all together, so thank you for having me. I was going to share a couple of slides with you, but I'll just make sure that our hosts share this information. Some of it has been shared already, but it'll give you a nice visual representation of the statistics across some of the counties. And so I'll make sure that all of the links and everything are available to you. I know a lot of people don't really understand the difference between county government, local, and federal. I know that we have some educated people on this line, but I just want to make sure people understand what our role is and the services that we provide. And so county government is truly an administrative arm of the state. And so we should be aligned with whatever Governor Evers orders. That is our job, okay? In addition to that, we should ensure that we are providing that quality of life to all of our citizens, right? That's our role. And I have a chart that I'll share in that presentation, but it kind of breaks down what counties look like. So there are 72 counties across Wisconsin. We've been focusing in quite a bit on Milwaukee today, which that is the bulk of our audience, so that makes sense. But all of the counties have been impacted by COVID. So I want to make sure that we're aware of the breadth of this situation. Now, the counties that we are very close to are in Southeast Wisconsin, and there's a couple of them, right, including Ozaukee and Milwaukee, and I represent Ozaukee. I'm starting my 3rd term this month. The frontline services that we provide are public health and human services. We've talked about that quite a bit. Dr. Izzard shared some amazing information, so thank you for sharing those statistics and that information, Dr. Izzard. 911 operators come from the county, first responders, law enforcement, coroners, medical examiners, all those frontline service workers are from the county. So I want to make sure you guys understand and are able to differentiate that. As county supervisors, we all serve 2-year terms. We're elected by people within our district. Some of us are full-time, some of us are part-time. So for me, I'm a part-time supervisor, and so I'm also in academia. So I'm very close to everything going on in education because I'm a executive director at Cardinal Stritch University, in addition to being a county supervisor. So I'm like really straddling both sides. So this was great information for me today as well. The stats that I shared basically are the stats that you had already heard. We don't have a lot of Black constituents in Ozaukee and Washington County, so we have not had any Black deaths in our counties like Milwaukee has. I know Milwaukee has had up to 177 deaths, and so but the highest death tolls are across the following counties. So there's Milwaukee, there's Dane, Waukesha, Racine, and Kenosha. So those are like the top 5 counties that are experiencing this. The resources that I wanted to share with you are really resources that help you in various situations. You can go to the Wisconsin Department of Health Services website for these resources. But I've listed resources like crisis hotlines. I had some of my constituents on this call, so I don't know if any of them are left. So thank you for joining as well, because there are Black people in Ozaukee County, y'all. And so, but they were on. And so anyway, the Public Health Department has information and resources. We have information as well on local food pantries and school district meal sites. This is all across Ozaukee County too, not just Milwaukee. So I want to make sure that you guys understand all of that. And so I don't have much more to share in the interest of our time. I know we're running a little over, so thank you for this opportunity. I've appreciated being a part of this today.
Thank you so much. Supervisor Martin, are you there?
Good afternoon, everyone. I'm so happy to be with you all. And yes, I am the supervisor for Milwaukee County District 7, which is the northwest side of Milwaukee that encompasses the Garden Homes neighborhood, the Indigenous Peoples Park area with the Columbus neighborhood, along with the Sherman Park neighborhood, as well as Deneen Park. I just wanted to let folks know, and I am so thankful that the supervisor from Ozaukee reminded all of us that COVID is everywhere. And as it was stated at the top of the town hall meeting, this virus that we're dealing with right now, the coronavirus, COVID-19, does not discriminate along any lines. It is impacting every single community, every single ethnic group, and no matter where you're migrating from or immigrating from, most likely you know someone who has been impacted. We want to talk about resources today that are available. I am going to encourage people to look. If you have internet access, I have to remember everybody doesn't have internet access, but if you have some type of access to the internet, go to MilwaukeeCountyWI.gov, and you want to click on the COVID-19 link and make sure you're looking at that COVID-19 dashboard on a daily basis. This dashboard is updated periodically throughout the day. It is refreshed from 7:30 a.m. to 2:30 a.m. and then again 2:30 p.m. and then again continuously throughout the day. As of 20 minutes ago, we have 3,016 cases in Milwaukee County. 3,016 cases of COVID-19 in Milwaukee County. We have 176 deaths. If you look at the dashboard on the Milwaukee County website, you can get this broken down by the total numbers of deaths by race and ethnicity. And I'm going to just quickly pull this up, if my fat fingers would let me. We currently have, and this really shows, while our African American community and our brown community has been hit pretty hard, this dashboard will show you that it is across all boards. We have 91 deaths in the Black community, 72 in the white community, 10 in our Latinx community, 2 in our Hawaiian Pan Islanders community, and 1 in a multiracial community. So we get those numbers and we see that it does indeed impact the African American community more. And we know that we've heard at the top of this town hall, Dr. Izzard explained it very well, and as well as our Lieutenant Governor, that our African American community may typically be hit harder with these types of diseases because of underlying comorbidities or underlying health factors such as diabetes, lupus, sickle cell, arthritis. It goes on because we typically have higher numbers with those comorbidities. But again, it's across the board. And we want to make sure at some point, our community in Milwaukee, that we have some type of format where we can come together and have a meeting and really talk about those issues and why they're so prevalent in our communities. We understand the racial impact and discriminations, inequities, so on and so forth. We're going to stipulate at the top of this meeting that we have that those are things that are there and they are contributing factors. And now what do we do? How do we respond? How do we move forward from it? How do we navigate or change our trajectories in our communities? What is within our power right now, today? How do we begin to change that? Because that deeper issue that we all know that is historically there, we're going to work on that too. As we know, Milwaukee County has just done another racial inequities resolution that is finalized and passed our board, Milwaukee County Board of Supervisors, and the executive has now moved into the next phase of how we're going to address all of these issues. So we're going to have those two things going on at the same time, but we must start thinking immediately of how do we tackle these issues and concerns and what is within our power to change our trajectory in our community and how we can be more healthy and responsive and responsible. So with those points of COVID-19 in Milwaukee, with our deaths, the racial ethnicity breakdown, on the north and northwest side of Milwaukee, there are a lot of cases. We thought we would see more flattening, and Dr. Izzard probably could speak to that as he did earlier. Hopefully, we will start seeing a little bit more of the flattening, but I see that we're ticking up a little bit again because it's nice outside. People want to get out. We encourage you to do that, but remember social distancing, remember your face mask, remember your gloves. That's where we are right now. We will continue to work with those things. One issue we wanted to highlight was my office gets a lot of calls about the House of Correction, the Milwaukee County Jail, and surprisingly, no one has asked me about our juvenile detention center, the Vale Phillips Juvenile Detention Center, which I am so happy to say we have absolutely no cases from the children or from the staff. And I am in contact with them on a weekly basis, and we may ramp that up to make sure that we're staying on top of that and that we're absolutely getting good, solid, viable information. With our House of Correction, this one we have 94 confirmed cases, 1 pending test thus far, no hospitalizations. We have 25 inmates that have recovered from the coronavirus. And in the Milwaukee County Detention Center, the jail for the adult facility, we have 3 confirmed cases, 4 pending tests, 57 negative tests results back. No deaths have been reported in either of these facilities. And as far as the staffing side, at the House Correction, we have 6 confirmed employees with COVID-19. In the Milwaukee Detention Center for Adults, the jail, we only have 1 staffer, thank goodness. And again, on the detention youth facility side, we have 0. Our population in the House of Correction right now is 791. So out of that 791 inmates, we have 94 confirmed cases. And again, with the adult facility detention center, we have a current population of 664 with 3 confirmed cases and 4 pending, and the 57 negative tests that came back on that. So that's where we are with our House of Correction situation, and we will stay on top of that because, as we know, this changes not only day by day, but from minute to minute. The initial report, when I first asked about this, and thank you, Representative Myers, for touching bases with my office in regards to that. A couple of weeks ago, they were saying, oh no, we are good. We don't have anything yet. But within moments, I would say within a few hours, we had a correction come back saying, wait, we have an employee showing symptoms and we have inmates showing symptoms. So we're continuing to work with Superintendent Haithman in making sure that we're getting daily reports on what's happening with the House of Corrections. I know they had a plan in place. We want to review how that plan actually was executed. Where did we see any deficit needs for improvements, and where our staff excelled at? And we have to just do a deep dive into how we are protecting those that are in our custody and under our direct supervision.
Okay. We have one question that I had. I'm looking in the chat box. I don't see anything right now, but we did have one question, and it says, are we able to leverage Milwaukee County declaring racism as a public health crisis during the COVID-19 pandemic? And if so, how can we use this declaration/resolution as leverage? So that would be a good question.
I just jump in.
I was going to say, let's hear from the Congresswoman on that.
Thank you so much. You know, I am pleased that Milwaukee County made that declaration. I believe that. I believed that it's a mental health crisis more than anything. Mm-hmm. But one of the things the Congressional Black Caucus has done is that we want very specific. In this last COVID package, we put in money for testing. And so to the extent that we have seen this disparate infestation, we have tried to make sure that our communities get provided with a dearth of equipment. Just like Dr. Izzard explained to you all earlier, you know, it's not a matter of someone being able to stand there and give you the test. Once they give you the test, you got to have the chemical reagents to process it, to get the results. And because of our capitalist economy, you know, you might have 30 different machines that take 30 different size Q-tips and their own chemical reagents. And so our capacity to test people is not there. So it's a very competitive thing. You know, whenever the vaccine comes out, you know, we don't want to be the last in line to get it, and we don't want to be the last to get tested because, you know, if we can test folks in the Black community, and we do have more dense populations than other people and isolate them, we might have a chance to, you know, what do you call it, Doc? To flatten the curve, at least in our community. So that again is another priority. I just want to say one other thing, since we've had such a long discussion about what state and local governments do, and I was really happy that the representative from Ozaukee County really laid it out. The big battle we're going to have when we go back is getting $1 trillion for state and local governments. Again, that's fire, police, the teachers, the people who are the first line responders to this, and to make sure that they have enough money. I mean, we had $175 billion in that first coronavirus package, but because the private sector was also eligible to compete against state and local governments, it definitely was not enough money. I mean, New York could have used the whole $175 billion itself. So it's going to be the knock them down, drag them out. And I mentioned it when I first opened up my comments, because it's construed to be, red state versus blue states. It's perceived to be growing government. So we're now back into the ideological, partisan politics with regard to funding states and local governments. But indeed, as the supervisor said, that's where the rubber meets the road, on the county level, when you have to figure out what to do with prisons. I mean, that Dr. Iser, those data that she gave us, that's greater than the population of infestations in the United States. That's growing fast at the House of Corrections. And we need to have the resources to take care of it.
Yes. And I also wanted to say to Representative Bowen, if he's still on, thank you for sharing your story. I'm so thankful for that, and thankful for your recovery. To the Congresswoman, thank you for your work. We know it's not easy, and especially when you have folks who are truly not treating this as seriously as we would hope that one would, as being a national leader. But I also wanted to address, someone had sent a question in regarding our Department of Aging and our seniors. As a lot of folks know, senior citizens and our youth are two of my passions. And if you ever want to see me angry, screw with a senior and a juvenile, and you'll see a whole different Felicia come out of the woods. Our seniors, the Meals on Wheels program is still functioning, and our transportation for getting our seniors to our appointments are still functioning. Of course, it's not going as smooth as we would like, because we don't have all the resources that we need. We know that these are underfunded, and we really, truly need to look at that. And that is something that I will be looking at again, and hopefully connecting with our state as well as our Congresswoman and our U.S. Senator in regards to this. And we also know that, unfortunately, as part of that stimulus package, that we can't use those dollars for our typical Meals on Wheels program. So we do have numbers for the Meals on Wheels program, as well as transportation for our aging population, and that is on our Milwaukee County website. But we will make sure that information gets to you all so that you can include it on a common website where people can go. But I want to start getting people used to contacting my office direct, so that we can address questions, as well as having them have one entry point for the Milwaukee County, which is going to be our website, where we have a multitude of resources that's available to our residents throughout Milwaukee County. But I wanted to make sure I put on everyone's radar in Milwaukee. I've been working with Ascension, Wisconsin. They have a weekly call or a bi-weekly call where they're releasing these testing sites that they have made available throughout Milwaukee. And they are currently working on a mobile testing site, having that unit go throughout the neighborhood so that we can capture people right where they are. That is in work. That is something that is in the works. And I hope to be reporting back soon on what that status is. And they also have a payment program so that those who are uninsured or underinsured, I don't want to state how much people are going to be responsible for, but we do know that there is free testing available according to your needs. And they, Ascension, Wisconsin will be releasing a link where you can go and see where you fall, so you'll know what your expectations can be when you go and have testing done. And as everyone has said, the testing is limited. So those who are displaying the most severe symptoms will most likely have the testing versus someone who just comes in with a few aches and pains, but you're not having multiple symptoms of COVID-19. So I wanted to make sure I put that out there as well.
Thank you.
Yes, and as far as the 7th district is concerned, as a final note, I will be doing a deeper dive into knowing exactly how many of those COVID-19 cases are within the 7th district and how many deaths. But again, I am trying to amplify the message. I'm driving through neighborhoods, talking to our constituents and making sure they understand what the expectations of our residents are and how we all can help each other and get through all of this together, because I truly believe all of us working together, we can get things done. And I know we will make it through. All of us won't make it through. So let's be realistic. Some people will die and already have died from this. So we need to take it seriously and just try to stay healthy, mentally, physically, and spiritually, and love one another and care for one another. Thank you.
Thank you so much. I'm going to go to Representative/County Supervisor Sheila Stubbs, if she is still here. Representative Stubbs.
Hi, my name is Sarah Ishmael. I'm Representative Stubbs' legislative aide. She's currently still in committee right now. The State Affairs Committee hearing is going quite long, so I'm going to be presenting in her stead. She gives her best wishes, and she wishes she could be here.
Absolutely. Go
I
right
said, my God, you've changed, Sheila.
I like your hair, Sheila. That's what I was going to say.
Well, I will tell her that. I will tell her that indeed. So I actually have a PowerPoint presentation, and I'm going to go through it very quickly. I'm going to share my screen with you, and so please let me know if you are able to see my screen. Okay. Okay, so what you should see at the moment is my iPad.
Okay.
Is that what you see?
Yes.
Yes, ma'am.
Okay. All right, that's wonderful. Okay. Thank you for bearing with me. All right, so thank you very much for allowing Representative Stubbs and myself to present what we know about the impact of COVID-19 on the Black community in Dane County. One of the main themes that you'll see that I've actually heard throughout many presentations today is that we need more data, right? And that is the case in Dane County. Currently, according to the Dane County COVID-19 public health dashboard. As of today, there were 57 Black people confirmed with COVID-19. Yesterday, there were 55 people confirmed with COVID-19, and that compares to 324 white people confirmed with COVID-19, and yesterday there was 320. If I need to go more slowly, please let me know. As far as Black people hospitalized, 11 Black people, according to the dashboard, have been hospitalized with COVID-19 today. 324 of white people have been hospitalized with COVID-19. And you can see the respective differences between today and yesterday. Yesterday was eight black people hospitalized. And then yesterday it was 320 white people hospitalized there. So far, according to the county dashboard, 3 Black people have died with COVID-19. That means one more person, one more soul has passed since yesterday. And the last I checked, this morning on the dashboard, there did not seem to be an increase in deaths for white people. Here's something that is going to suggest a trend, which I'm going to address in a little second. 19% of Black people with COVID-19 are hospitalized, and the 5% of Black people with COVID-19 have died. Now, when I talk about that statistic, what I'm talking about is out of the total amount of cases that the dashboard has indicated. So I'm talking out of 57 people, okay? When it comes to the white population, 27% of white people with COVID-19 are hospitalized, and 5% of that population from the dashboard have passed away. Now, what you're going to see is about an 8% difference from 19% of Black people being hospitalized versus 27% of white people being hospitalized. I will let you know, I'm going to admit, these were very, very simple percentages that I did specifically with those specific numbers on the dashboard. I repeat, so it's really important that when you are talking about this presentation or the numbers in Dane County, know that I'm speaking from that specific dashboard within those small numbers. And in fact, it's not enough to establish any sort of trend or any sort of conclusion, except for the fact that a little bit more of white people are being hospitalized with COVID-19 at a slightly higher rate than Black people, as indicated by that dashboard. Here's something that's really interesting and important to note. So the DHS data for Dane County differs slightly. So from the Dane County COVID-19 dashboard provided by Public Health, Madison and Dane County, we see that there are 431 cases that appeared on that dashboard in total in Dane County, and that the DHS data had 428 cases in total for Dane County. So one of the things that we really want to make sure is that when you're looking at data, make sure that you know which data set you're looking at. If you're looking at the states, or if you're looking at the county dashboard, or if you're looking at a third party's research indications, even the CDC. So we're not seeing a total exact matchup, which is to be expected, but it's very important to note when we're talking about numbers. This slide you're not supposed to really focus on it, but what this is this is actually the state data from DHS 19's disaggregated by race. And so the big circle here, you can see DTH WHT, you can see DTH BLK, DTH ASN. Now, the reason that I'm showing you all of this is because there are numbers that you can see, and they correlate actually if you go to the left-hand side of the screen. I've highlighted 2 columns. One is object ID and one is load DTM. Basically, I don't know what that means. Nobody really knows what that means except for the researchers who actually coded the data themselves. So it's possible to break down that number that DHS gives us when it comes to the total amount of deaths of Black people in Wisconsin statewide. It's possible. We just have to make the specific ask to go in and have the researchers tell us how they actually named the not the variables of themselves, but what these numbers mean in terms of which county or which zip code or which geographical area that these numbers under these columns correspond to. Now, this is publicly available data. You can go to the website, DHS website for COVID-19, download the state data, and then spend hours puzzling over it like me. But I wanted to bring this to your attention to know that it's important to be able to keep pushing for the disaggregation of this data so that we can know how many people are hospitalized. We can know how many people not only have been tested, but how many people are hospitalized from the state data, to add another data point as well. We just have to know how to ask the right questions about the data. One of the things that I wanted to focus on too briefly, as what has been talked about today, is that a Black population in Dane County, we are more likely to have comorbidities with COVID-19. So a lot of the underlying conditions that make people in general more susceptible to COVID-19. One of the things I want to draw attention to is, and I didn't do every single pre-existing condition or comorbidity, but I did want to point out that 37.6% of the Black population in Dane County does have diabetes, or did have diabetes, according to the Wisconsin Department of Health Services 2014 to 2018 estimate. And even though those are slightly outdated numbers, that's one of the things to really consider when we're talking about the impact of COVID-19 on our Black community. In addition to that, how many of our Black people, how many of our community members, how many of our brothers and our sisters are able to get their insulin, are able to get the food that they need to balance their blood sugars, or to go to the doctor. So all of these things are compiling specifically onto the people in our community. I'm not going to go ahead and read that quote there. Essentially, it reiterates the point that I was already making about the stress, and one of the worries being the comorbidities, among them being diabetes. So in terms of a proposed solution, there's no solution to a pandemic, really. There are many multifaceted, steps that we need to take. One of the things that we recommend is to not only have more testing, but to have more testing and to have our own research that specifically focuses on Black people and COVID-19 within Dane County and across all of the counties when it comes to Black people. The important thing about that is because we are not actually getting, we don't know the variables, we don't know kind of what goes into the data when the state collects it, or when the dashboard public health collects it. I mean, we can find out. But one of the things that I think it's really important to do is to kind of start thinking about, okay, well, how can we help these agencies? How can we help them actually get more research and kind of get more data points on our communities? Additionally, having communication networks among agencies to be able to corroborate numbers between, the state and the county, and the national numbers as well. That communication between agencies and networks about what counts as a hospitalization, what doesn't count as a hospitalization, is going to be super crucial for us to be able to attend to our community. I'm going to share some resources. So I'm pretty sure everyone is familiar with the United Way of Dane County. So obviously you can dial 211 to speak with someone. The text option is there, and then you also can visit the online website. And a part of my presentation actually is the graphics. You can click on the graphics, and that will actually take you to the website. Some other resources, the Dane County COVID-19 food resources. You will see here, this is actually put together by a number of partners at the bottom here. What I like about this resource is that it tells you not only about food delivery, meal kits, but it gives you more in-depth information about SNAP benefits, etc. Now, this might be slightly updated, so go ahead and check the Public Health Madison and Dane County website for more information. The next resource that I want to share with you is the list of Madison resources for impacts of COVID-19. Now, this is actually a document that is continuously being edited. It's a Google document, and it has hotlines and other numbers for support. It is actually a much more thorough guide as to some of the resources that are out there. Again, this is an ever-evolving document that people and community members add to. I have the links here. You can see the links there. Also, the presentation, which I will be sending to you, you can also click on this document and it will take you to that site. Another resource, community resources like the Progress Center for Black Women have different resources to actually talk about what's going on and to, of course, see if there's any funds that can go towards Black women and small businesses. Now, this is just one of many different organizations, community organizations within Dane County. I chose to highlight one, but we know that there are the churches in Dane County, and there are other foundations run by Black people in this county that offer resources such as those. The list of emergency and recovery fund grantees for the United Way actually just came out. And so here are all of the organizations that were awarded funds. So you can go through and you can look to see which organizations have gotten which funds, and probably update your list in terms of telling constituents, which organizations might have a tiny bit more extra room or availability based upon them being the recipient of funds. Now, I'm not going to take that with a grain of salt. One thing that I'll say is it's very helpful to know that our community organizations are, in fact, receiving some funds. These actually wonderful graphics are available on the DHS website in terms of how to make a cloth mask and in terms of what to do with cleaning and disinfecting a home. And they might look really cute and wonderful, but it's actually very important. We don't have masks, we don't have PPE, and the majority of the labor force in Dane County when it comes to Black people are in the service industry and are nurses and teachers, right? And so if we don't have enough PPE, even we need to be distributing resources that help people who need to make their own masks and PPE out of what they have in their home. Now, these particular infographics are available in Spanish and they are available in Hmong. Go ahead and contact me or just go to the website to find those versions as well. So I don't know why there we go. If you have any questions, go ahead and send an email to me, Sarah Ishmael at legis.wisconsin.gov. I'd be happy to share the resources. I'd be happy to discuss the finer points of the data and really kind of how we can get the information that we need to actually start moving and mobilizing. Feel free to send an email or Zoom or what have you. Thank you so much for allowing me to present today.
Thank you so much, Sarah. I appreciate it. And please, I will be sure to let Representative Stubbs know how wonderful you did representing on her behalf. So
amen.
Thank you.
Absolutely. I will say this. I thank you all for holding on so long. I know it's long. However, I felt this was very, very necessary. But I would be remiss if I did not go to Dr. Aronica Williams. Dr. Williams, and I know we have Dr. Kevin Izzard still with us, but Dr. Williams is the Chief Medical Officer. Isn't that your title, Dr. Williams, or am I making that up?
No, that's right.
Or am I taking that away from the other Dr. Izzard? You can correct me if... Okay, that's right. Okay. So I wanted to introduce Dr. Aronica Williams, who's at Milwaukee Health Services Incorporated, and she will be our last speaker for this evening. But we started with a doctor. We're going to end with a doctor because I want to reiterate the importance of prevention, making sure we have correct spacing, testing, and she can give us information about how tests are administered, where we can go to get tested if you are presenting some of those symptoms, what we should do in the case of an emergency. And I'm sure she has a lot of other things she wants to tell us. So take it away, Dr. Williams.
Awesome. Can you hear me okay?
Yes.
Awesome. So like Representative Myers said, I was tasked with with going over prevention, spacing, testing, and other services. So under the topic of prevention, so the CDC and the World Health Organization recommends several actions that everyone should participate in. So the first is staying home as much as you can, going out only if necessary, working from home as possible. It's already been said throughout this teleconference that may not be possible for many African Americans and Latino workers. And one of the things that I read, which I think I definitely wanted to leave with this group, is because African Americans and Latinos are disproportionately in low-wage jobs. The extent that we want workers to shelter in place, we have to consider the capacity to shelter in place. That whole topic is racially shaped, and so that's something that we're going to have to definitely take a look at, because there are a lot of data sources out there that talk about, just even broken down by different racial and ethnic backgrounds, that African Americans and Latino workers, because they're in retail or in working in customer-facing service jobs, their ability to work remotely is severely limited. So that, coupled with the disproportionate effect of diabetes, high blood pressure, those types of things, that makes it a dangerous cocktail for groups that fall into those racial and ethnic backgrounds. So that's something that we definitely want to keep in mind. Keeping a safe distance. So when we talk about a safe distance, we've known that we're supposed to be avoiding close contact with people who are sick, putting a safe distance between yourself and other people. So at least 6 feet, we say that's about 2 arms length away. Do not gather in groups. Stay out of crowded or mass gatherings in crowded places. Keeping space between you and others is one of the best tools that we have to avoid being exposed to this virus, and of course also slowing the spread both locally and globally. Now, since people can also spread the virus before they know that they're sick, it's going to be important to stay away from others when possible, even if you do not have any symptoms. That's why this shelter in place is so important. Lastly, social distancing is especially important for people who are at higher risk of getting sick. And so we know that those are the folks that fall into those vulnerable categories that Dr. Izzard mentioned, but also people who are at extremes of age as well, and people who have certain conditions that may affect their immune system. Some of the things that you may be seeing or hearing about and some of the strides and updates at provider offices. So many provider offices have implemented alternatives to face-to-face patient visits so that they may offer patients an opportunity to engage with their healthcare provider over the phone or through a teleconference. There are also strides to designate areas at health facilities for evaluating patients with fever or COVID symptoms, where those patients that fall into those particular categories can seek care away from patients who do not have those symptoms, trying to kind of separate the sick and the well. Also, things you may see is that they've been canceling group healthcare activities and also postponing elective procedures, surgeries, and non-urgent outpatient visits. Moving on to washing our hands. So we've talked about that. You want to clean your hands often, either with soap and water for 20 seconds. So someone may say, well, how long is 20 seconds? So sometimes, so people have said you can sing happy birthday twice, or the alphabet song, or you can say the Lord's Prayer. So that's as long as 20 seconds will last you, so that you need to be using soap and water. If soap and water is not available, using a hand sanitizer that contains at least 60% alcohol in it. You definitely also want to clean and disinfect frequently touched objects or surfaces daily. That's your countertops, your door handles, your light switches, faucets, things like that. Covering your cough. We've heard this, we've seen it, but it never gets old because, again, we're talking about prevention here. Covering your mouth and your nose with a cloth or face cover when you sneeze around others and immediately throwing that into a trash can. Covering your cough or sneeze with a tissue, like we said, and throwing that in the trash. And so coughing into your elbow if you don't have a tissue, but if you do have a tissue, throwing that immediately into the nearest waste can. And then lastly, for prevention, if you are sick, stay home and call your doctor's office ahead of time. This helps us as your primary care provider to be able to prepare for you if we're going to see you in the office, to offer you one of those virtual visits that we talked about, either over the phone or through the camera, but also to be able to provide you with that anticipatory guidance that you need at home, things that you can do to help yourself get better and also to prevent spread to others that may be around you. We talked a little bit about testing earlier. I just want to go back and just let you know there are several healthcare entities that are offering COVID testing. Like I said, I represent Milwaukee Health Services. I put the information in the chat, but our clinic, as well as all of the other federally qualified health centers, have expanded their testing to test patients who are evaluated by one of our providers who have symptoms. So we're not at the point of just testing everybody, but if you do have symptoms and you don't have a healthcare provider, we will definitely take you on. You do have to see one of our providers at one of the 5 federally qualified health centers in the city of Milwaukee, but we have definitely expanded our testing ability to test anyone who has symptoms. And so that's a huge move from where we were about 2 to 3 weeks ago, where only the sickest of people were able to be tested. So now if you have symptoms, you have to be evaluated by one of our providers. Like I said earlier in the teleconference, we can do that kind of like we're doing now through a video or a phone call, and then we can get you tested. So this is a wonderful opportunity for residents on the north side, residents on the south side, or wherever you reside. And again, federally qualified health centers, our mission is really to provide for those who are underserved, those who are uninsured. We see all patients regardless of the ability to pay. That doesn't mean we're a free clinic, but we do base things on a household income. And so we welcome the opportunity to provide great care for anyone who is in need of it.
Doctor?
Yep.
Representative Myers, may I ask a question?
Go ahead. You already asking it, Senator Taylor.
Well, I didn't, so I want to make sure, but thank you so much. Hi, Dr. Izzet. I wanted to ask the question of whether or not the standard, first of all, where the standard of testing is defined. It's my understanding with the Department of Health Services at the state level, if that is or is not correct, or is that a federal, standard? That's my first question. And then the second question is, if people can be asymptomatic, then what sense does it make that we're only testing in an area that already shows a high concentration? Why would we only test if you're showing symptoms? Because that means we're still not trying to address those that are asymptomatic is, my impression.
Okay, so your impression is definitely well taken. However, it has been already stated that there's still a shortage of supply. So it's not that we're not attempting to address it. It's just that this is actually kind of coming in waves. So before, only the sickest people, we were told that even at the hospital level, if you were not sick enough to be hospitalized, you would not get a test. We are worlds from there. We're definitely worlds from where we're trying to go. But there's still not enough tests to test somebody who doesn't have symptoms. Because here's the thing, if you don't have symptoms today, but you have symptoms tomorrow, who's to suggest that you weren't exposed from today to tomorrow? So the thing is that we're doing what we can with the resources that we have at our disposal. Let's backtrack to your the previous question. Where is the standard?
Or are we? Or could we be asking for other resources and we're making reason and excusing where we are, and we could be asking for more based on what our need is? And so that's my point.
No,
Can I
the
jump in there? Because you got to keep in mind that the tests we're talking about are different tests. So we're talking about screening people. The test we do right now is called a PCR test. It's looking for the virus. So they take a sample. They are able to amplify the viral DNA or RNA in this case, and they're able to detect if you have an infection. Okay. The next test that's going to be coming around is going to be an antibody test, and that's probably going to be more useful for what you're talking about, Senator Taylor, where we can actually find out what is the prevalence of people in our community who are susceptible or who have been infected already, because that's what's going to be most helpful when we talk to people to go back to work. It'll be helpful to know if you're a healthcare worker, if you're immune, then you don't have to worry about all the CPE.
But doctor, do we even know if someone can get it again and whether or not
we don't
are
know,
immune?
Yeah, we won't know it until we know if you have antibodies, but we don't know that information yet. When that test comes out, they won't be able to start testing people and say, okay, you had an infection, you made antibodies, now you got this again 6 months later. Okay, that shows that the antibodies weren't effective or they don't last that long. But we don't know that yet. So yeah, it depends on what kind of test we're talking about.
But I think that's the point that I'm making, which is whether or not we are or are not, testing and asking for as many tests and trying to build that industry or support that concept within our state and putting all hands on deck in that way.
Yeah.
Whether it is either type of test.
Right.
And the only thing I'm saying, as someone who represents a community that, well, as you know, has been highly affected, is that I believe that we should have had a different sense of urgency that I did not see locally, and that we need to have a greater depth of testing than we do. And so that's what I see. That's what my understanding shows me. And that's what I'm advocating for. And I know that you're working with what you have, but I'm trying to find out, am I wrong?
I tell you what a bigger problem is. We don't even have thermometers. Have you ever tried to find a thermometer? You cannot find a thermometer at any of the local, at Walgreens, Pick and Save, you name it, Walmart, none of them have to have a thermometer. You can't get it on Amazon. So how do we tell people we tell people if you're feeling sick, check your temperature. They can't even check their temperature because they can't find a thermometer. So that's
huge.
Even before the testing.
Exactly.
Well, no, I don't think we're disagreeing. I think the thing is that, I mean, we're definitely advocating. We consistently, and, Senator Taylor, us. I mean, we advocate for the best to have for not just our patients, but the community and the catchment area that we serve. Where the standard of testing, that was your first question, the standard of testing and who needs to be tested, that was just expanded from DHS, I believe at the beginning of the month on April 6th to test anyone who has symptoms. But to your point, right now we are in a phase of diagnostic testing, not screening testing. As supplies become more plentiful, we very well may get there. But I think that we're all in the same fight. And we can't become any less relentless in that fight to get more tests to serve everyone. And so that's what we're trying to do. Anyone who walks through our doors, like I said, if they have symptoms, we're testing them. Absolutely. We are doing diagnostic testing. We're not at the point of screening testing because simply you will just burn through everything that you have. The other piece is that if we go back just even a month ago, even if somebody had symptoms, the providers didn't have the PPE to even receive folks in order to properly care for folks. So again, this virus is teaching all of us, and we're learning as we go. And as we continue to learn more, like Dr. Izzard was saying, of course, we're learning about this antibody. We're learning about, okay, can you get it again? You might get a different strain, much like the flu, although this is different. There's so many different strains of a virus. So you may get coronavirus, but you may get a different strain. Again, we just simply don't know, but we're learning as we go. Because I know that we are short on time, I will kind of go through some of the other services that we do provide at Milwaukee Health Services. Again, we are full spectrum primary care. So regardless of your age, we serve all patients. from cradle to grave, and everyone in between, women's health needs, family medicine, internal medicine, and we do have some specialty services, behavioral health, podiatry. We treat patients who have hepatitis C and HIV. We have on-site pharmacy and on-site radiology. And we have a branch of the WIC program here. But one of the things that I think that is especially important is during this time where people are sheltering in place, people who may have been affected by COVID and they are quarantined and cannot get out to have food. Our outreach and enrollment and social services department is connecting with each of those patients to determine a needs assessment. And we're connecting folks with food share, shelter, landlord mediation for those issues that come up with rent and their mortgages, and if anything of the like. Also clothing, we are delivering masks, disinfectant products, and toys and activity packets, because we know that everybody is stuck in the same house, and so we're trying to make sure that we are also partnering with local agencies to provide food for families of 4 for people who may not be able to get out and have those resources, or get out and get food because they've been told to stay in because they are affected by COVID. So that's a brief overview of the things that you asked me to go over, Representative Myers. But again, we're here to serve. We're definitely here to see all patients. Again, we cannot necessarily accommodate everyone. If you have a primary care provider, I know one of the myths is that, just bring your order to MHSI. We can't accommodate that. But if you do not have a primary care provider, or if you're a patient of ours, of course, any of your healthcare needs, we are able to service you in the clinic or also virtually. And then for patients who have COVID or COVID symptoms, we're able to take care of that as well.
Hey, I want to thank Milwaukee Health Service for all you guys do for the community, because you guys are definitely a resource for our community. One thing that we didn't really address today, and Representative Myers, this may be something we need to come back for, is what does it look like when we finally start to get back out? Because that's one thing we have not really addressed. We look at, again, Atlanta's going to be dealing with it. Georgia's going to be dealing with it. But what does it look like when we finally get out there? Are we going to feel safe? Are we really going to be protected? How do we help these small businesses that don't have PPE? And how are we assuring that they're going to be following safe practices? So that, I think, is a conversation that's one thing that Cream City we're starting to get into is, when the time comes next month, maybe, how are we going to ensure that people are safe once they go back out again? And so I challenge anybody, or I welcome anyone who wants to have that conversation, with Cream City. And we're thinking about using, I know in the past we've done things with barbershops and beauty salons with training people to talk about things like blood pressure and diabetes. But that might be a good resource, a good place where we could spread information to the community. Because if you can have people talking junk, you're going to hear it in the barbershop, you're going to hear it in the beauty salon. But if that person was trained, with facts, and then they could spread facts instead of spreading rumor and innuendo about things. And so that might be a good way we could educate people, community. So, but yeah, I think we need to figure out how to make sure that things are safe once we open things up again. And if you want to contact me, we have at Cream City, we have an email. You can email me at COVIDMKE, so COVIDMKE @gmail.com, and that's our box we have for COVID related issues.
Absolutely. Thank you so much, Dr. Williams, and thank you, Dr. Izzard. Before we wrap up, I want to just go back over what Dr. Williams said, what I heard you say, and I'm going to interpret this a little bit differently because you said it so eloquently. I want to explain it the way somebody who may not, know better will explain it. You said, don't come to me first, call me first. I heard that. And then I heard you say, I can treat you over the phone or over your computer first, possibly. You don't have to come see me first. But they still need to make a call. Okay.
Right. But if you call first, I can tell you the best way to treat you.
There you go. Okay. And just in case some of these businesses decide to open up, like, I don't know, pot of water me, I should probably stay out of the casino, right? Because that's a crowded place. Okay. if my cousin is having a barbecue, I should probably not go, right? Okay, I just wanted to make sure that's what I heard. Okay, I believe that's what you said. But I want to make sure that on behalf of the Legislative Black Caucus, I want to thank all of the participants that we had today. And thank you for everybody who stayed on the phone. I know it was a long meeting, and we had a lot of information to go over, but this will be the first of several series that we're going to do. We are going to take you, Dr. Izzard, up on your request to work with Cream City about the plan once outside opens back up. So we'll know what to do when we get out there so that we can be safe and make sure that we are doing the correct things. I want to give Representative Stubbs the opportunity to say hello because she is out of committee and she can be probably tired from hearing the same old story all day long.
Oh my God. Well, first, thank you, Chairwoman Myers. Hello, everyone. Bless you all. I hope everyone's safe and their families. I'm still in committee, but I quick ran downstairs because I had to say hello. Thank you so much for participating. Thank you so much for your words. I'm sure you received the PowerPoint from my new staffer, Sarah. Help me welcome her aboard, but I'm really thrilled that we're having some genuine conversations about people that look like me, people look like you, African Americans that are so greatly impacted. Committee is interesting. You'll have me have a round two. I hope Chairwoman Myers will have a round two after what we might hear, things might be opening up. So thank you all so much for all that you've done, all the information you supplied, and have a wonderful day.
Thank you so much. Once again, I want to thank all of the members of the Legislative Black Caucus. I want to thank Dr. Kevin Izzard from Cream City Medical Society. Thank you to Congresswoman Gwen Moore. Thank you to Lieutenant Governor Mandela Barnes. Thank you to Director Marva Herndon from Milwaukee Public Schools. Thank you to Sarah Ishmael from Representative Stubbs' office, Supervisor Jeanette Braverman from Ozaukee County, and Supervisor Felicia Martin from Milwaukee County, Representative Fields, and Dr. Aronica Williams from Milwaukee Health Services. So thank you all for the work that you do. And see, even Representative Stubbs is showing us what we're supposed to be putting on and how we're supposed to look when we walk around and be around people. She has her gloves and her mask on already. We want to thank you all so much. The chat is, all of the items that were in the chat today will be available on the Wisconsin Legislative Black Caucus Facebook page. And each of us as individual members will have information available as well. Don't forget, if you do not have a primary care physician, I'm a living witness. Milwaukee Health Services is for everyone, and they have doctors that are available to serve you. So I thank you for having them represented here today, and thank you to Cream City Medical Society as well. Thank you all, and have a wonderful evening.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. EYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.